Hey, Felipe.
Good morning.
Good morning, Felipe.
Morning, everyone.
Jennifer, it sounds like Steve is calling in, and Jackie is as well as having the same password issue you were having, so Bennett's helping her.
Morning, Michael.
Good morning, good morning, good morning, good morning. I'm sorry, I had trouble getting in.
Good morning, everybody. There's a little bit of feedback. Or is that me? Can you hear that?
No, I think it's Michael. There you go. Thank you.
Good morning, everyone. Jackie Sherman sent a note telling me that she has called in. Bennett, can you confirm that she's on?
I'm still working with her to try to confirm that.
Okay. Okay, well, as soon as she joins, we will have quorum. We don't have quorum at this moment. So hopefully soon we'll have quorum and we can begin. My apologies to everybody who is on already, just some technical difficulties this morning. No matter how much time we spend on these web conference calls and conferences, the challenges still present.
Hi, Jackie. I think I just unmuted you. Are you there?
I'm here.
All
Can you hear
righty.
me?
We can. Thank you.
I can hear
Okay.
you. And so given that we have Board Member Jackie Sherman, Jacqueline Sherman, Board Member Bobby Cohen, Board Member Felipe Franco, Board Member Michael Regan, and myself.
We may also have Steve Saffier by phone. Bennett, is Steve on the line?
I'm also working on it.
Okay, but I believe that we can begin. We have quorum. And so I am going to call to order the October meeting of the New York City Board of Correction. We will now begin the meeting. Our first order of business is to approve the September 2020 minutes. Will a board member move for a vote to approve the minutes?
So moved.
Second.
Wonderful. Are there any edits or questions, debate concerning the minutes? Hearing none, I ask for a vote to approve the September 14th, 2020 minutes. May I have a motion?
Aye.
Aye.
All right,
Aye.
and aye. The minutes have been approved. So we're going to turn shortly to the substance of the agenda, but we do have a couple of announcements. The first, I want to provide a brief update on the board's restrictive housing rulemaking. We announced in June, as those board members, those on the call will recall, the mayor and I called for the ending of punitive segregation. A working group was formed, led by Vice Board Chair Stanley Richards, and including Commissioner Brand, COBA President Benny Basio, and Just Leadership USA President and CEO Deanna Hoskins. They've been working diligently over the last several months, and as I understand, they are pretty much near conclusion. They've been working to develop a disciplinary model that prioritizes safety, accountability, transparency, and support for people in custody and staff. The group's work is important for the board to implement a rule that is both progressive and practical to end punitive segregation. The working group, as I understand, has made great progress and I believe is close to providing its recommendations to the board's ad hoc rulemaking committee. Once the board's rulemaking committee considers the recommendations, the staff will draft amended rules for presentation to the board. At this point, the board will then request certification of the rule from the law department. Once the law department certifies the rule, we will publish the certified rule on the board's website prior to a public meeting where the board will vote on whether to approve the rule. Should 5 members of the board vote in favor of the final rule, the rules would go into effect 30 days after publication in the city record. Many know that we are working hard at trying to do this in October. Time is running out, but we're still aiming to meet that goal and to have a special meeting at the end of October. And if we're unable to meet that goal, then we'll vote at our November meeting. We want to make sure that the public has an opportunity to comment on the rule. We'll make sure that that comment period is held 10 days in advance of the meeting. And we're going to work hard to make sure that we abide by that commitment that we made several months ago. So one other thing I want to speak to current fiscal crisis facing the city and the Board of Correction. At the beginning of the administration, this mayoral administration, Mayor de Blasio and the City Council invested in the board as a key partner in the strategy to transform the jail system and the broader criminal justice system. However, from fiscal year 2020 to fiscal year 2021, the Board of Correction budget was cut 16%, with a 31% reduction in staffing to a head count of 27 staff. The administration has cut the board's budget even further in the first budget cycle of fiscal year 21. It should be noted that the Board of Correction is not alone. City agencies and services, vital public services and programs, including education and sanitation, and New York City's nonprofits serving vulnerable communities that provide critical services. All of these entities are facing big cuts as a result of the city facing a $9 billion deficit in fiscal year 21 and in fiscal year 22. We understand that these cuts are going to have a significant impact on the Board of Correction. We are making our concerns known, and we're letting the city and the council know that it's going to be a challenge to meet our charter mandate, our council legislative requirements, and the public's expectations. Notwithstanding, we're still going to work to provide effective oversight because that's crucial, especially in this time as we're moving towards new borough-based jails and restrictive housing rulemaking reform. So, wanted to share that with you.
Chair Austin,
Please.
has the Department of Correction budget been cut 31% as well?
I do. Okay, thank you for sharing that. Thank you.
Oh, has it been?
Has it?
Yes.
I cannot tell you definitively what the cut is. We can ask the commissioner, but I do know that their budget has been cut as well. And I do know that there have been, there's been word that there may be as many as 22,000 New York City worker layoffs. So yes, I do not know the exact amount, but we'll follow up and we can ask the commissioner to let us have that information. It's probably available to her today. I'm sorry, who's speaking? I believe someone was speaking. Okay. Let's now move to the remaining items, the other items on the agenda. We'll begin with a CHS and DOC coronavirus update from Meg, from Executive Director Egan.
Thank you. We've asked the department and CHS to provide an update on the response to the COVID crisis. As the recent uptick in local cases has reminded us, COVID-19 is not over and the jails are not isolated from the risks of a second wave. We call on DOC and New York State parole and the court system to work together again to reduce the jail population. The jail population has increased 14% since the end of April. This is an additional 551 people who are now at risk, requiring DOC and CHS's attention and increase the density of the housing areas. In just the past month, the jail population has increased by 218 people. As of October 2nd, the jail population includes 623 people who are 50 years of age or older, an increase of 31% since April 29th. Currently, there are 43 people age 50 or older who are being held solely on technical parole violations. From June 29th to September 27th, Correctional Health Services provide health-based advocacy letters in support of release for 526 individuals. These people should not be in jail. The jail population remains a critical factor in mitigating the impact of COVID-19 on the jails, and an increasing population is dangerous. As of October 6th, reported 2 active COVID cases in the jails. These cases still appear to be confined to new admissions to the system. Additionally, as of October 2nd, there have been a total of 209 CHS staff members and 1,433 DOC staff members diagnosed with COVID-19. In the past month, there were 6 additional DOC staff cases and 2 additional CHS staff cases. The board continues to publish weekly COVID-19 data reports on its website. We recently added a metric to the weekly public report, which documents housing area density by housing type, dorm or cell, and category. As of October 1st, there were 67 open dorm housing areas, and 135 open cell housing areas. 66% of open dorm areas were above 50% capacity, and 57% open cell housing areas were above 50% capacity. Of the 105 open general population housing areas with cell and dorm, 73% of housing areas were above 50% capacity. In comparison, on September 3rd, 67% of open general population housing areas were above 50% capacity. In addition to producing weekly data reports, board staff continue to conduct targeted on-site inspections in the jails. In the past 2 weeks, the board has visited RMSC, GRVC, and the NYC main and annex twice. After the board, city council, and advocates raised concerns regarding limited mask use by DOC staff, the department issued a directive on September 24th, which requires DOC staff to wear a mask when it is not possible for the employee to maintain a distance of 6 feet or more from another individual. The directive also strongly recommends that staff wear a mask when interacting with the public and other employees in an indoor setting, even when it is possible to maintain a distance of 6 feet or more. The directive requires managers and supervisors to correct noncompliance and allows for disciplinary action. The department previously issued teletypes the department previously had teletypes in effect. Emergency Executive Order 100 remains in effect, and the department's suspension of visiting congregate religious services and law library continues, along with the suspension of outside service provision. At the September board meeting, the department said they would begin congregate religious services and barbershops in the weeks following that meeting. The department has not announced any plans to resume in-person visiting. The department should resume these important services as soon as possible in the safest manner possible. The New York State prison system resumed visiting in August, and the federal prison system resumed visiting earlier this month, both with restrictions. The department might learn from the precautions taken by the state, including limiting the number of people on the visit floor, identifying outdoor visit space, and appropriate PPE use to protect people in custody, staff, and families. We ask the department for an update on the plans to resume these services and invite board members to raise any questions for the in the department.
Very good. Good morning.
Good morning.
Does the department have an update on resuming services or visitation? And then we can open it up to the board members for questions.
Sure, this is Brenda Cook, Chief of Staff. Good morning, everyone. So yes, the department has been working diligently across all of the internal labor unions and our leadership, and with our partners at CHS and the city's Department of Health and Mental Hygiene, to both monitor incident rates in the community and our facilities very closely, and to develop plans for the return of these services that respects the risks that COVID-19 continues to present in our city and in our jail community. We As we previously described at last month's meeting, Barbershop and Religious Services we anticipated would be returning first in sequence. And in fact, they have. Last week, we piloted the return of Barbershop services under our plan. And the pilot provided housing areas at NYC with haircuts and gave us valuable information on scheduling and the sanitation, and also certain critical but not yet worked through functions like the service of meals both within the housing areas and lunch breaks for our staff. So we're currently working with our labor stakeholders to review and finalize the plans based on the pilot that we operated, and we anticipate rolling out these services in the next 2 weeks. Religious services will be provided to people in custody in groups of 10 beginning next week. The services and the chapels will be sanitized between services, and people in custody will be permitted to bring their own prayer books. We'll schedule additional services as staffing and spaces permit in order to accommodate as many people interested in attending the services as possible. In some cases, the prayer services will be simulcast through technology installed in the chapels in order to ensure services are provided safely to as many interested people as possible in a way that meets their needs. With respect to visits, we are committed to reopening our in-person visitation in the safest possible manner for visitors, people in custody, and our staff. Due to the nature of our facilities, bringing back in-person visits requires the development of a multifaceted, coordinated plan, providing for social distancing both during the registration and screening, on our buses as we travel to the visit houses, in visit waiting areas, in the facilities, and on the visit floors. All visitors, our plan is developing for all visitors to be screened for COVID-like symptoms and to go through a temperature screening in order to access the facilities for their visit. All visitors will be required to wear masks, and we'll have masks in adult and child sizes available so that any visitor who does not have a mask or wearing a mask with metal material components will have the opportunity to wear a mask that is safe and appropriate for their visit. To achieve safe social distancing for everyone, we'll be rolling out a pre-registration system similar to the system and the manner in which we are scheduling televisits. Our visits floor capacities will be reduced and visits will run on a schedule rather than providing visits on a rolling basis. Our pre-registration system for in-person visits had to be developed from scratch. That system is being demoed this week, and the staff will be trained on the technology following the demo. In support of this new technological system, we've identified and will allocate more than 20 department staff members to support the scheduling of these visits and the screening of visitors upon arrival. In addition to training on the pre-registration system, those additional staff will be trained on our existing Visitor Express technological system, our televisit scheduling system, and customer service principles. We're in the process of fixing hundreds of social distancing cues throughout central visits on our transport buses and on visit floors in order to remind people of the necessity to maintain a safe social distance throughout the visit process. Our visit floors will be rearranged to allow each visiting group 6 feet of distance at a minimum from other visit groups. Tables will be rearranged to keep that 6 feet or more of distance between visitors and people in custody. This will allow us to conduct socially distanced visits without the use of a physical barrier. Visit floors will be sanitized between each family visit hour, and the Environmental Health Unit here at the Department of Correction will provide appropriate training to people performing the sanitation work and anticipates that staff and persons will be fully trained by the end of next week. As our preparations continue, we're also finalizing our conversations and reaching agreement with the health department around critical metrics needed to evaluate our service delivery as we continue in a reopening. And if a sudden increase in COVID positive cases occurs, we have a process and a method to respond. We'll continue to engage with our labor unions across the department staff on all aspects of our plan. And when in-person visitation reopens, we will continue to offer televisiting 5 days a week during non-in-person visit hours in order to maximize people's opportunity to continue to connect with their loved ones in a manner that is safe and respectful of the needs of everyone. Thank you.
Yes, thank you, Chair Austin. To the department, I have a few questions. One, at the beginning of the pandemic, the department was responsible for and was did terrific work arranging for certain populations within the jails, independent of their medical status, to be released. How many? And that was done through the I think it was a 5A program. The city has the right to. The city under the state has a work at home kind of program, and you also work on getting city sentence people who did not fit categories that you, except for those who fit certain categories, released. How many of those kinds of releases have occurred in the past 2 months?
So, Bobby, I believe you're referring to the 6A program.
The 6A, yes, I'm sorry, 6A.
Yeah, the 6A is a work release program that the department can review and release folks who are city sentenced, so serving sentences of a year or less. And we initially had addressed our city sentence population, as you know, back in March, and then released approximately 300 people to the 6A program to continue to serve the remainder of their sentences in the community under supervision of community-based organizations. Since that time, our population of sentenced individuals has been under 100 or at about 100, and we have continued to evaluate those in the sentenced population for their fitness for release into that 6A program, and have released a number of additional individuals. I don't have the specific numbers with me at present, but we can certainly return that to the board today.
Well, I'd appreciate it if you could give us those numbers. The second question I have is, the department has a responsibility itself for the safety of its staff and the safety of the people who live in the jails, independent of the CHS responsibility. And other prisons and jails in the country are testing their staff, sometimes on a one-shot, sometimes required, for example, the Michigan prisons are requiring multiple times a week of COVID testing for their staff. My question to the department is, given that the quarantine and testing program that the persons living in the jail and entering the jail are subject to will have a great effect on limiting the entree of COVID-19 coronavirus into the jails. One of the main sources is for people who leave the jail each day and come back, and to protect them and everyone else, has the department developed a plan to provide routine weekly testing at some interval for the staff with COVID-19. This is not thermometer screening and checklists, but rather actually doing some kind of routine, regular COVID testing.
So, Bobby, the Department of Correction doesn't provide treatment, medical treatment and care services for staff. The department has made available and continues to publish in a variety of formats, both by email, by teletype, by posters in the facility, staff's availability of testing for all staff throughout New York City and in the surrounding boroughs. We have dedicated staff testing capacity since April 6th with Northwell Health Hospital System, and that's in addition to the city sites and locations. We certainly have educated our staff and continue to discuss the need to and the value of keeping themselves, people in our care, and folks in their homes and in their communities safe by getting regular testing that's available to them. in recognition of the fact that they are coming into a work setting every day and leaving and returning home the same. And so while we don't provide for the testing for our staff, we have certainly and will continue to encourage all staff to get tested as frequently as appropriate, and flagging for them, as the city has done in the public awareness campaign, that even if you don't have symptoms, that is not a reason not to get tested, that in fact everyone should get tested whether or not they present symptoms.
Okay, I understand that you're doing that, and I appreciate that, and do want to comment that I did visit the facilities last week, and the mask wearing by the staff was dramatically improved from what it had been before. But my question was not what can people do, it is what is the department thinking about working towards as a policy. My last question is based upon the comments that Meg made in her opening remarks regarding the fact that I believe most of the dorm housing areas, in fact, almost all the housing areas are greater than 50% capacity right now. The department has announced that it's about to close 2 more buildings, and as we have also heard, that the population is increasing dramatically month by month right now. Why do you think it's safe to make the jails more crowded at this point, as the city is facing a very, very serious problem in large parts? The city, of course, is planning on doing testing of staff and students in its schools, as do other places. So I'm concerned about that. What plans have you made to close down these beds at the Manhattan House and OBC, put them into existing facilities which are already overcrowded, to not put everyone at increased risk?
So thank you for that question, Bobby. I want to correct some inaccuracies in it. So with respect to our jail closures and the facilities that will remain following the closure of Manhattan and Otis Ransom Correction Center on Rikers Island, we have thousands of beds, and I think it's near 100 housing units in jails that will remain open, that are presently closed, that we can and will open in order to house the several hundred folks who may remain in our custody at those 2 facilities at the time we are closing them. So first and foremost, again, I think it's important to dispel the inaccurate conclusion you're drawing that we are going to pack people in and add people to housing areas without recognition of the tens of thousands of beds that we have available in entire housing units that are currently closed. Second, with respect to why we are, why we feel it's appropriate to do these things, I think, as we identified at previous meetings, and as we certainly I'll defer to CHS to talk about at length and more specifics, we have created a space within our jails where we have not seen a transmission of COVID of a person in custody that's not a new admission that's come in and been identified immediately at new admission since May 19th. And so we have tremendous systems in place with correctional health services to identify and early detect anyone who is entering our system who may either be presenting with symptoms or and refuses to test, or who has tested positive for COVID. And so we are confident that we are doing the right things, and our process is yielding success in that respect. And so at this point, I'll defer to CHS to make remarks in that regard with respect to patient care and our COVID housing, testing, and success.
I was endorsing the CHS's approach to quarantine. My question was about identifying asymptomatic persons within the staff. I was not criticizing the way CHS is testing and keeping people for 14 days. Although I am interested in where the intake is going to be when you close down these buildings. You have been able to use a system where almost everybody goes to Manhattan House and is kept there. And now that won't be available to you. So where will intake be?
So Bobby, we've just announced, as you noted, on Friday, and as Mike described, and so we are going to be discussing with our partners at CHS our operations and our strategies moving forward. And so that at this point, I don't feel comfortable speaking out of turn until we have made those decisions in partnership with CHS.
Do you have any more questions at this point?
Yes, James Perino. I'd just like to add on to what Bobby was saying. If there's hundreds of cell beds that's available, then why aren't we utilizing them now to keep the population lower? And with a push to end punitive segregation and minimize stuff, and then not creating more violence, by separation, closing Manhattan House with 9 South, which was a tool for the department to minimize punitive segregation with those cages, and OBCC with EHS, which happens to be actually running pretty well, lately under the direction of Warden Renee. You close that, now you have those high classification people, which I know you don't have the space in the department that those 2 facilities create. So that's going to be a huge challenge. And how are you planning on working with those challenges and housing the most dangerous individuals and minimizing punitive segregation, focusing on actually ending it?
Thank you, James. So to your concern with respect to the population at MDC and 9 South, the census in that unit is about 15 people or less. So we certainly have the ability in the department to rehouse 15 people who require a high level of security safely. With respect to ESH, we have worked with the State Commission on Correction to identify space in another facility that we will make necessary modifications to house that population in its entirety, and we will do so seamlessly and safely. So the department has been always very thoughtful and will continue to be very thoughtful about where we put our most challenged individuals in custody, the manner in which we house them, and the supervision and leadership that guides those facilities. And so as we transition over the next 2 months to close these 2 facilities, which in total between OBCC and Manhattan, there's a combined total of about 750 folks in custody who live there. We'll use our traditional jail closure methods of attrition from custody, in order to draw down the population at those facilities in the first instance. We'll look at those special populations, as I've just mentioned, and we have identified the appropriate housing relocation for them. And then with respect to new admission, the new admission population, which is the bulk of the Manhattan population, we've always had new admission populations at a number of our facilities across the department, including the remaining facilities on Rikers Island. And so the new admission population, as Bobby identified, that we will work with CHS on, the risk largely that the new admission population presents for us is the ability to identify, test, and quarantine for the periods necessary for COVID. And so that's the primary issue with the new admission population. It's not a matter of jail security or classification and housing. So I thank you for those questions.
Well, just curiosity, being the warden in MDC and also being the chief over it, where would you put those people that are in those enclosures that you're going to keep them in such an isolated spot in the department? I mean, have you developed other areas that you make? I've been out for 4 years. Maybe you build other areas, because the only place I know is NYC, which I'm sure is going to have people in it already. So in order to, those 15 people that says it might be such a small number, but where are you going to put them? I mean, you just can't put them in regular housing areas.
James, I'm not going to talk about the specific housing relocation in a public meeting, but I certainly am willing and able and interested to have a conversation with you offline, including with Bureau Chief Security, Chief Stu as early as today or tomorrow, if you'd like, but we're not going to discuss specific housing assignments in a public meeting.
Yeah, that sounds great. I'm really willing because I'm very curious. Like I said, that's going to be
We can set that up.
especially closing punitive segregation. That's going to be a real big focus. But thank you for your answers. I appreciate them. And
I just want to say something.
Is this Michael?
Yeah.
Okay, please.
You know, Board Member Perino has every right to ask a question like he just asked. To suggest that this oversight board is a public meeting, we discuss things, an unacceptable answer.
I'm not suggesting it's an unacceptable question. I'm taking issue with the matter of security of the specific discussion of the reassignment of individuals in our custody in a public meeting.
I think you guys have to figure out that this is an oversight board. The commissioner's absence today because she had a conflict is unacceptable to me.
Yeah, I think that, okay, I agree with what Michael just said. I think the fact that the department cannot say that where it's going to place physically restrictive housing, which is an ongoing public discussion about what's going to happen when we get rid of solitary confinement, where those units are going to be, what they're going to look like, is not a security discussion that has to be done in private.
That is not what I said.
Of the board. What we're going to do at this point, as I understood the questioning and the response, I appreciate the point that that Board Member Michael Regan brought up. Very much appreciate that. As I listened to the conversation and the exchange between Brenda Cook and Board Member Perino, I interpreted what she was saying as being concerned about getting into some particulars at this particular time publicly. I understood Mr. Perino as understanding and accepting that. Conversations about changes in PSEG and where people will be housed and what that will look like are part and parcel of the restrictive housing rulemaking and the recommendations that are being brought forward by the working group to the board's ad hoc committee. They do not need to be aired and shared at this particular point in time because the recommendations are to be presented to the working group.
This board has every opportunity to go into executive session when it wants to.
Understood, and we are at a point at this particular time where those particular issues are being finalized by the working group. That particular issue concerning changes to punitive segregation to then be presented to the working group and then in turn to the full board. If there is a need right now, if board members feel that there is a need to go into executive session in this particular moment to talk about that work, we can do that. At this particular time, what we have decided was that the working group would finish its recommendations. We've seen some of them, we've had some questions. We decided that they would finish them and then present them to the group at large, the board at large. If the board feels at this time that we need to go into executive session, I will entertain that. But nothing is being withheld. I just firmly believe that at this point, as the working group is finalizing its recommendations, it is not an imperative that they be shared at this time publicly. They're not yet final.
Jennifer, I just want to also correct, while Commissioner Brand is not present in the conference room with me and other leadership here today, she is on the phone and she is participating in this meeting.
Thank you. I asked my fellow board members, is there anything further that you all want to discuss with the DOC on this issue? CHS has yet to present. Is there anything you want me to take into consideration at this time?
Jennifer, can you hear me?
Yes.
Yeah, this is Felipe Franco. Hi, Brenda. I mean, last time that you actually did a closure, and again, sorry, it escaped me the name of the facility, you had to move adults, I believe, into the RNDC. Would that be an issue here again? Would there be more adults in close proximity to young adults?
I don't know, the particulars of who will remain in our custody and need rehousing as of the time of the jail closures. But certainly, you know, our young adult population is a few hundred individuals in custody, and all of our remaining facilities have far more beds and capacity than that. So I can't imagine that, you know, that there will be there's not a plan to have a facility that only houses young adults. The young adults are housed at a facility that also houses an adult population. Presently, that's RNDC, and so we don't envision that changing. So I don't know if that.
Do you plan to have more adults than you have now? I mean, it used to be a young adult facility until you did a closure before. Will that have an impact of having more adults close to young adults?
We don't expect that this will have an impact of having more adults in housing units comparable with young adults, if that's your question. But certainly to the extent that we've been doing work, for example, at RNDC on the buildings with respect to the door project, and we've been adding air conditioning to the uppers in buildings 1 through 6 at RNDC. Those buildings, you know, as they come back online, there's 12 housing units in each building. I'm sorry, 6 housing units in each building, 2 on each floor. And so we expect that, you know, those beds in those housing units will be utilized appropriately, whether or not it be young adults or adults. I can't say at this point.
Thank you. Keep it abreast.
Thank you, Board Member Franco. Is there any other question at this particular time or comment that anyone wants to make?
Hi, this is Jackie Sherman. And I just had a quick question. First, thank you very much, Brenda, for the detailed description of the groundwork that is being laid for resuming visitation. And it could have been, I was having technical difficulties, so it could have been that I just was unsettled at the time. Did you state during your description the timeline within which you anticipate that visitation will begin?
We have several of those remaining components that we expect to take place over the next 2 weeks at a minimum, and so I don't see the visits will reopen as soon as those things are finished. But I can't imagine that it will be earlier than 2 weeks, given the demoing of the technological registration system, the training of the additional 20 plus staff who will be supporting both the scheduling of registered visitors, the sanitation of the and the schedule of how that will operate to refresh the housing, the visit unit floor in between each group of visits, the discussions that remain to be concluded with the Department of Health and Mental Hygiene and the city's administration with respect to our reopening plan, and some of the structural modifications that we're making to both the transportation and the visit floors.
Got it. Thank you. And do you anticipate that visitation will reopen on a phased basis, prioritizing specific facilities, populations, or will you be ready to go live across all of the facilities within that time frame?
We expect that the system would resume in its entirety. We've obviously had to make modifications to the capacity in order to maintain the visit floors and the social distancing, but in comparison to visit numbers that predate the pandemic and the various facilities visit capacities and actual visit numbers prior to, we expect that we should, on a visit schedule, be able to accommodate and reopen visits across the department when our systems and processes are finished in their preparedness.
Thank you.
Thank you.
Brenda, this is James. I have one last question with regards to religious services. Now, I happen to know RNDC, and I don't know why this number stuck in my head, but has a maximum capacity, the chapel, of 250. Now, you have GRVC, which happens to have a very small chapel. Some facilities have big ones, some facilities have small ones. You threw out a number of 10. Is it a consideration to maybe to make that number adjust to each one of your facilities based on the social distancing and the space of each one of the chapels? And if you have like 20 people, 25 people that usually go to Catholic services and you only have 10, then would another option possibly be, have 2 or maybe 3 services? Because I know there's several of your chaplains that are just eager to get back on track and reach out to the population, even though they have been going to housing areas, to try to get some normalcy back into that operation.
Yeah, absolutely. We're adding services to the schedule in order to accommodate the capacity of interest. We're also, as I mentioned, in some cases, the prayer services will be simulcast through technology that we've installed in the chapels for that purpose. And we're also starting with 10, and we're trying to minimize commingling of various housing units if possible. It's something that we will explore as we roll out the reopening and address whether or not we can increase capacity, and of course always being mindful with both city and state guidelines with respect to congregate settings as well. And so it's 10 is how we will start, and we will proceed cautiously and with safety in mind.
Thank you.
Is CHS going to give us a report on COVID and your work effort?
Sure. Good morning. It's Patsy. Thank you. From Meg gave you our data, which is positive. Thank you. That still holds. We have currently 0 active cases in the jails. Our only positive cases had been new admissions. We have 0 incidents, 0 prevalence, and we stand ready to stand back up as the epidemiology requires.
Are there any questions or comments? Bobby?
Yes. Do you have any plans to, in the event of a recurrence of the pandemic within the jails, as we have seen in certain communities in New York right now and around the country, to recommend routine testing of civilian and security staff with one of the COVID tests and at some frequency?
No, we don't. I in terms of protecting our patients, certainly, as well, we know at the top of our country, you can get tested every single day, but if you don't exercise basic public health measures and precautions, you can get sick. That really remains our emphasis, which is housing, keeping people together, minimizing movement between houses, focusing on testing new admissions, and certainly encouraging staff to get tested as they wish. But that is that's a point in time and doesn't really protect you.
At the beginning of the epidemic, you and your staff were the leadership in this country in terms of trying to empty the jails as much as possible to allow your staff and the people that you work with and who you care for to survive this pandemic. Could you tell, and I understand that you did that by identifying people who were at medical risk, and you defined that according to certain clinical conditions and age. A third of the people over 50 were removed from the jails over a very brief period of time, and hundreds of people with serious medical problems through your assistance were released from the jail. Could you tell me how many people have been released because of your work identifying them as high risk because of age or medical problems over the past 2 months?
Actually, it was a little more than half of our patients over 50 who were released, and we continue to do that. Specific to COVID, that's augmenting our ongoing preceding COVID and continuing compassionate release. I don't have the numbers, Bobby, in terms of how many people got released.
Okay, could you provide them to the board?
Yeah.
Okay, thank you. Sorry, I undercut. Congratulations on the 50%. That was wonderful work. But the population is up a lot now, so something has to be done differently.
It is coming back up, unfortunately, but I do believe that the number of the people who we were able to have released for clinical reasons, less than a handful, I think, have even come back.
Great.
That's good to hear. Thank you. Are there other questions, comments? Any other board member, would you like to add anything at this time? Okay, let us now turn our attention to an update on the borough-based jails. Executive Director Egan.
Thank you. In 2017, the city committed to closing the jails on Rikers Island and developing a smaller, safer, more humane network of jails in the boroughs. The City Council approved the ULURP for the new jails in October of 2019. Throughout this process, the Mayor's Office of Criminal Justice, the Department of Correction, and the Department of Design and Construction have been working to develop design proposals for the new system. In addition to the overarching goals of the new system and the jails themselves, the board's minimum standards and oversight will continue to play a critical role in the operation of the city jail system. We've asked the Department of Correction to provide the board with an update on the timeline for releasing the design build request for proposals, closing and demolition of the existing jails, and building new jails and fully moving off of Rikers Island. I will now turn it over to the department to provide the board with an update.
Sure. Good morning, Tim Farrell. So we are continuing the original vision with the borough-based program, which is constructing 4 new modern facilities, smaller, safer, fairer, and decommissioning the other existing facilities on Rikers Island. The population we are projecting for is to house within these 4 facilities 3,300 individuals. That has not changed. Each facility will be equal in number at 886 beds. And the 4 sites that were cited have remained the same. The existing Manhattan Detention Center, the existing Brooklyn Detention Center, the Queens Detention Center, and then the NYPD tow pound located on Bruckner Boulevard in the Bronx as the 4th facility. While we're moving very aggressively along with these plans to meet our 2026 completion dates, we were in the process of developing the RFQs, the RFPs for the dismantlement and construction of these facilities. However, when COVID hit, we had to pause the planning and designing of these facilities due to the budgetary implications and the diversion of funds to deal with the pandemic within the city. So from March through July, our PMC, the program management consultant, who's working as a liaison with the city and the design build teams when they're chosen, on pause, and there was very limited amount of work that was being done, certainly not to the magnitude of being able to finalize and refine the legal RFP documents that are necessary to solicit for a contract. In July, we received approval to begin to bring back the PMC and their staff, and we have since been having very regular meetings and discussions and on the technicalities, the facilities themselves, room adjacencies, room data sheets, getting everything prepared for the issuance of the first RFP. We are looking at Manhattan as being that first facility that will have the RFP issued for. And because of the COVID and the delay, we are now projecting the completion date of the borough-based jail program is 2027. And all elements within the design, programming, space, environmental, all remains currently intact. There's no changes to that. If anything, this COVID pandemic has, and during the pause, allowed us to do a little bit more aggressive forward thinking, like, okay, we're building these new facilities. We just experienced this COVID pandemic. What can we take with best practices on how we managed it and how we need to develop facilities to better be able to deal with similar types of circumstances? So it did allow us to redesign and look at how we would have dormitory beds so we can increase the social distancing aspect, compartmentalize them to a certain degree to eliminate that close proximity of each other. Putting into the design specs much more enhanced HVAC systems with much greater filtration systems to circulate the air and create a more sanitized environment. Looking at surfaces, common area surfaces from desks, tables, countertops, to introduce more antimicrobial surfaces that aid in the sanitation to keep that sanitation going. So this pause helped us out in that aspect. It ultimately caused a bit of a delay on the completion of the project, but it's giving us the ability to introduce more to these facilities to make them better and more efficient.
Are there questions? Comments? Bobby?
Yes, the department has been having meetings with the Board of Correction for 2 years now on the planning process involving, and I read the documents that were provided us today, and they did not seem to go beyond what I received from the department 2 years ago. I have some specific questions which I've asked over time, and also the question that I asked before is the board's is going to lose 31% of its staff. What percentage of the staff of the department are you going to be losing in the new budget? And then I'll ask my other questions. Do you have that number?
Bobby, the number of staff that the department potentially will have to lay off is the layoff discussions are occurring within the city. We face at minimum, I believe it's about 1,200 staff that we will lose across the department with the initial layoff discussions. With respect to the department's budget, that's our personnel budget issue. With respect to the remainder of the department's budget, we have to maintain physical plants, facilities for the life of the duration.
I was just asking about staff.
Yes.
So that's about 11% of your staff, or something like that. Is that right?
Bobby, I think that the longer that the delay occurs with respect to the city's resolution of the budget shortfall, I think the number will continue to increase. As I assume people are aware, all of our managerial non-union staff will take 5 unpaid furlough days between now and March, and so that is a significant budget cut for both personal people individually, and again, a savings for the city. But these are real crisis times for the city, and we appreciate that. And part of our jail closures will represent hundreds of millions of dollars in savings for the city to operate a size of a system that is more appropriate for the numbers of people in our custody.
I was just trying to understand the number of percentage of your staff that's being laid off. And I guess it's about 11% at the current moment. I have a number of questions about the new facilities. I'll ask them all at the same time. One I know was the case before, but maybe you rethought things. Where will women be housed? Where will young adults be housed? Where will the structural restrictive housing units be established? Where will CAPS units exist? Where will PACE units exist?
So to answer your question, Bobby, thank you. The female persons in custody have always been designated to be housed within the Queens facility complex. That is unchanged. That is the current plan, and that's how the design of these facilities are being incorporated to manage that population within Queens. As far as your other specialty housing area, young adults also will be represented in each of the 4 boroughs, keeping with the plan to house individuals in the borough of residence to improve upon those family connections and ease of access. We will have a population that represents each of what you asked about present in each of the 4 facilities. So we can, even though you'd be designated if you have a special population need, we still have the ability to manage you in your borough of residence in order to have that continuity of care and involvement with your family without being disrupted by moving to a facility further away. So we did not want to centralize all of our special populations under one roof. We have the availability and the design to offer these services and manage these populations in each of the 4 facilities. And I will let CHS discuss on, the CAPS and PACE and other mental health programs, what they envision them to be. But we will have an example at each one of those facilities.
And before CHS begins, I just want to add to your earlier question about our budget, Bobby, that the Department of Corrections budget year over year has seen a reduction in our personnel headcount that you may not be aware of. And so since you're focusing right now so intensely on the reduction in budgets, I would advise that you return to the adopted budgets year over year for the last several years, where the department has had more than 400 civilian vacancies removed. So those are taken. Those were by and large either vacant at the time or the department was not able to backfill. So we have seen a continued reduction in our in our staffing capacity at the Department of Correction, in addition to the projected potential layoffs that the department will be taking a considerable share of what has now been discussed as a citywide approximately 22,000 layoffs. So I just wanted to add that to the conversation and encourage you to review our adopted budgets that are available publicly to see that headcount reduction year over year.
Thank you.
Thank you very much. Are there other questions or comments?
CHS was asked to comment on the mental health aspects of the new plan.
Design, almost half of the bed count will be therapeutic housing units. We're really excited about that. They'll be designed to accommodate people with mental health needs, medical needs, and/or substance use needs. These will be designed similar to one another so that we can use it for whatever patient population needs those environments. But it's a significant increase, and they'll be in all the 4 jails. And I just wanted to give you the number that you'd asked for on the earlier issue, Bobby, from March 13th through October 4th, of the 1,754 COVID-specific release requests. These are not the regular compassionate release. These are COVID-specific. 62% have been discharged, 1,087 people.
My question was, over the past 2 months, how many have there been?
That one I'll have to get you later.
Okay, thank you.
Right, bye.
Are there other questions or comments at this time from the board? Okay, there being none, let us proceed to the agenda item concerning the Horizon transition.
Give me 1 second, a little technical difficulty. Okay. On October 1st, 2020, the New York State raised the age legislation went into full effect, so 16 and 17-year-olds can no longer enter DOC custody. As of July 27th, 2020, there have been no 16 or 17-year-olds in DOC custody at Horizon Juvenile Center or elsewhere. DOC and the Administration for Children's Services jointly operated Horizon from September of 2018 until the last person left DOC custody. The board continuously granted 4 variances from July 2018 through the end of September, and board staff actively monitored the jail throughout this period. With the full implementation of Raise the Age, DOC will no longer operate Horizon, thus the board no longer has oversight jurisdiction. We have asked DOC and ACS to present on the transition of Horizon to full ACS management and any continued role for DOC. I will turn it over to DOC and ACS.
Okay, good morning. Good morning, and all members of the Board of Correction. You can hear me?
Yes.
Good. I'm David Hansel. I'm Commissioner of the Administration for Children's Services. I am extremely pleased to be with you today in October 2020, which is almost exactly 2 years after the first phase of the Raise the Age law began, and with the Raise the Age law now fully implemented. And I'm joined by my colleagues, Charles Parkins and Tim Roach, both of whom I think are very well known to the board and will help me in answering your questions. So for the past 2 years, pursuant to the New York State Raise the Age legislation, 16 and 17-year-olds who were previously housed on Rikers Island and 17-year-olds who were arrested and detained between October 1st, 2018 and September 30th, 2019 have been housed at the city's Specialized Juvenile Detention, or SJD, facility at Horizon Juvenile Center. We've referred to these in our discussions with you as the pre-RTA, pre-Raise the Age youth. Our last pre-RTA youth left Horizon in July of this year, and effective September 30th, 2020, about 2 weeks ago, there can legally be no youth in this category. And in fact, as of September 30th, ACS surrendered to the state its SJD certification, given that there are and can be no youth in need of such a facility. And so Horizon is now certified as a specialized secure detention, or SSD facility, which is permitted to house and care for adolescent offenders whose cases are being heard in the youth part. The closure of the SJD and the full implementation, as you just heard, also marks the end of the Board of Corrections jurisdiction with regard to Horizon. We have come a very long way over the last 2 years, largely due to the partnership of many of the people who are with us in this virtual proceeding today. The advocates, mayor's office staff, our own staff, of course, our colleagues at the Department of Correction, at Correctional Health Services, and certainly not least you, the members of the Board of Correction. Implementing Raise the Age has required broad collaboration and partnership, and I am deeply, deeply grateful to all of those who supported and worked with us. I do want to take a minute to specifically thank my colleagues at DOC for literally being with us from the original transition of youth from Rikers in 2018 through the COVID-19 pandemic, providing safety and security, as well as guidance and support for our operations, our youth, and our staff. And I specifically want to thank CHS and the leadership of Dr. Yang for all of your tireless efforts, not only to ensure that youth at Horizon have the highest quality health services, but also for helping us to prevent the spread of COVID-19 within the juvenile detention system. And then finally to you, members of the Board of Correction, a very special thank you. Your passion, your commitment to ensuring that ACS had the tools and support we need to implement Raise the Age, as well as your thoughtful inquiries, guidance, and suggestions to make sure that ACS and DOC in partnership rose to meet these challenges has been very much appreciated. We at ACS are grateful to the board for your support and guidance in our efforts to successfully implement Raise the Age and to promote safety and positive outcomes for the youth at Horizon. So I could use all my time here to thank so many people for the success of this intervention, but I really want to provide you with an update on the transition and implementation of Raise the Age. As you'll recall, in September 2018, 93 youth transferred from Rikers Island to Horizon. In total, ACS has provided care for 425 unique pre-RTA youth, of whom 406 were boys and 19 were girls. As I noted, there have been no pre-RTA youth at Horizon since July, as all such youth either aged out of the SJD at Horizon or were discharged through the court process. As of October 1st, any youth arrested for a crime alleged to have occurred when that youth was 16 or 17 years old is now processed as a juvenile in the juvenile system. This long overdue reform is historic, and ACS has been honored to have been part of it. As you know, as part of the Raise the Age law, ACS and DOC were required to cooperate the facility for pre-RTA youth. This also gave ACS the opportunity to create a new title, Youth Development Specialist, to provide care and security for youth in secure detention. And to date, ACS has hired and trained more than 700 YDS to work in both of our secure detention facilities, Horizon and Crossroads Juvenile Center in Brooklyn. With regard to Horizon, ACS worked with DOC and our unions to develop a phased plan to introduce YDS to Horizon over a period of 6 months. Starting in April 2019, we began by bringing YDS supervisors to Horizon to observe operations. We intentionally assumed responsibility for direct care in multiple stages so that the transition would be seamless and orderly for both the youth and the staff. ACS assumed full management of the final haul at Horizon on November 15th, 2019, and by December 2019, ACS had assumed primary operational control of Horizon. While the city is continuing to take steps to reduce the number of youth coming into detention, one of the hallmarks of the Raise the Age law is that youth are no longer placed in adult facilities. Those youth who are detained are in a juvenile setting that provides for their safety, security, and well-being in a developmentally appropriate setting and manner. Youth at Horizon attend school on-site at the DOE Passages Academy, and they have access to extensive offerings of vocational training and ACS's large array of contracted programming, as well as on-site health and mental health services, all of which is intended to provide the therapeutic and educational interventions that improve a young person's well-being and life outcomes. Despite the many challenges that COVID-19 has presented, we've been able to continue to provide the highest quality care while maintaining health and safety. And the health and safety of the youth and staff in our secure detention programs is our top priority. For youth in detention and for the caring, inspirational staff who work with them around the clock, we've implemented strict protocols to minimize the health risk to staff and youth. We've continued to follow the guidelines of health officials, including DOHMH, State Department of Health, Health and Hospitals, Correctional Health Services, and our own Chief Medical Officer, Dr. Angel Mendoza. And as health guidance has evolved throughout the course of the pandemic, ACS has adapted and implemented new protocols as needed, and we will continue to do so. We also continue to disseminate up-to-date guidance to staff and youth about virus transmission prevention practices, such as hand washing, social distancing, mask wearing. Our detention facilities are regularly cleaned and sanitized, and we've increased the number of cleaning personnel. We've equipped our facilities with ample hand sanitizer, soap, gloves, and personal protective equipment for staff working with symptomatic youth. Nurses conduct temperature checks for staff on each shift, and our health partners conduct daily screenings of youth. All staff and youth have been provided face coverings. In the early weeks of March, after consultation with medical and public health experts, ACS executed a bold plan to minimize the spread of COVID-19, to limit the exposure of youth and staff to the virus, and to preserve then scarce PPE. The plan included maintaining the first floor of Horizon exclusively for youth presenting with COVID-19 symptoms. There, the youth would be housed in one area and receive 24/7 medical care from CHS. When the pre-RTA youth were still at Horizon, they were on the second floor. Especially during these difficult times, it's crucial to provide structure for youth and maintain our youth-focused model of care. Youth in detention continue to receive quality medical and mental health care, access to education and programming, and they're maintaining connections to their families. Programming is essential to enhance the therapeutic environment in detention while helping youth build self-esteem, take part in positive activities, reduce idle time, connect with role models and credible messengers, and develop skills to redirect their lives in a positive direction. We've implemented new types of virtual programming to engage youth while adhering to social distancing protocols. For example, youth have access to video games, movies, and books on their tablets. They're participating in virtual programming with our various partners, including a writing challenge through the KITE program, yoga, individual exercise challenges, and others. Strong family engagement, as you know, is another essential part of our model of care, and we've adapted to make sure youth can remain connected during the pandemic. Our case management staff connect with parents by phone at intake, and they call parents to provide weekly progress updates. One of our earliest and most challenging decisions during the crisis was to suspend in-person visiting due to the health risks. We set up access for youth to do televisiting by video, in addition to increasing their regular phone access so that they can maintain access with connection with families and with their lawyers. As has always been the case, youth can write and send unlimited letters to parents and family members. COVID-19 was certainly an unexpected and unprecedented challenge for us all. But I believe we rose to that challenge, and I'm confident that we will continue to rise to meet any future challenges at Horizon as we continue to carry out our responsibilities to meet the needs of all youth in New York City's juvenile detention system. Thank you again to the Board of Correction for all of your support, all of your guidance over the past several years. We have greatly appreciated and benefited from the partnership. And now my colleagues and I are happy to take your questions.
Thank you, Commissioner Hansel. Very, very much appreciated. Board members, any questions, comments? Are we silent? We very much appreciate all of the hard work, the effort. No small feat, a significant undertaking. And we're very, very thankful and grateful for the progress that's been made. and we'll be continuing to pay close attention and stay engaged. Bobby?
Yeah, I want to thank you, David, and your staff. It's been a pleasure working with you. I learned a lot. There's not much value in that, but I'm glad that the board was able to be engaged with this project. I do have a question. It's my understanding that the department is going to have a continuing presence at the facility, providing what they call perimeter security. Is that right?
That's correct. The department will have continuing presence for some period of time. They will not have any direct contact with young people, but they do have two continuing areas of responsibility. One is perimeter security, Bobby, as you mentioned. The other is helping to staff the control room. So those will continue for some period of time. And then, as you probably know, the regulations for SSD, Specialized Security Detention, which is what Horizon is now certified as, those state regulations do require that the department have a continuing role in co-administering an annual security review. And so they'll continue to do that as well, even once they no longer have an on-site presence at Horizon.
Yeah, I didn't understand that part, but I appreciate that. That it is. I know that the department was required to be there by law, but there's a continuing. You're saying the continuing requirement for a review. There's not a continuing requirement for the control room function or the perimeter security. Is that right?
That's correct.
And so I don't know if the board has the capacity or can contribute that much, but why would you say that the board does not have any more oversight role, given that the department is present there every day in critical areas? The control room runs, is very important, of course.
Yeah. Well, first of all, that is only transitional until ACS is able to staff up to take on those responsibilities. We'd hope to do that sooner. COVID slowed that process down to some degree, but we expect within a fairly short period of time that ACS will be able to take over those very limited responsibilities. But they're really purely administrative responsibilities. They don't involve any interaction or contact with youth. They don't involve any programming or any of sort of the kinds of activities that DOC had been performing before ACS took them over last year. So we don't think that falls within the board's mandate, according to the interpretation of our lawyers, and I believe yours as well.
Thank you.
Are there other board members with questions? Comments? Okay. Somehow you managed to silence us, Commissioner Hensel. Thank you very, very much. Thank you for all that you and your team have done. Very, very much appreciated.
Thank you, Chair and members. And of course, even though we won't be formally reporting to you, we look forward to continuing to interact with all of you. Thank you all so much.
Thank you. Thank you. All right. We are at the point of our meeting where the remaining business item is public comment. And so we will turn to public comment. I have to ask Mr. Bennett Stein, if you haven't already, and I don't see it in my email, please send to me the list of persons who have signed up to speak.
I think you should have it, but let me.
Jennifer, I just sent it again.
Okay, I'm taking a look right now.
Still nothing.
No. Please send it to both email addresses. It may be. Okay, here it is. I now have it.
Right.
Thank you. I do have to share that at the before we begin, we have several people. I'm glad that we will be hearing from them. I have to tell everyone that I have an unavoidable conflict that is very, very much tied to the work of the board that concerns policing and justice here in New York City. So, and that conflict requires that I be in place at the NYPD in about an hour and 20 minutes. So I will have to turn the meeting over at 11 a.m. I will join in by, I will stay on by way of phone or perhaps by WebEx to listen in, but I will not be able to facilitate the public comment period beyond 11 a.m. And so I am going to ask one of our board members to continue after 11 a.m. I will be listening. I just cannot facilitate. So we're going to begin with the process. People are probably very familiar with the process at this time with respect to public comment, but for those who are not, I'm just going to walk through how this is conducted via WebEx. We've been provided with a list of speakers who've signed up to speak. What I will do is call each person's name. When you hear your name, please raise your hand using the hand icon below the participant list on your WebEx screen. If you don't see the participant list, click on the silhouette of a person on the menu at the bottom of your screen. Once you open the participants list, you should see the hand icon in order to raise your hand. When you raise your hand, we will unmute you and you will be able to turn on your video. You can then begin your public comment. I will tell you when it has been 3 minutes and we will move to the next speaker. The board also welcomes written comments. You can email written comments to boc@boc.nyc.gov or mail them to 1 Center Street, room 2213, New York, New York, 10007. Okay, we'll begin. And the first person on our list is Darren Mack. Darren Mack. Okay, please begin, Mr. Mack.
Right. Yes, can you?
I can hear you. Yes, thank you.
Thank you so much. Thank you so much.
And we can see you. Good to
Okay.
see you.
Thank you so much. Thank you so much for having this hearing and public comments. My name is Darren Mack. I'm a co-director of Freedom Agenda, which is a member-led project dedicated to organizing people and communities impacted by incarceration to achieve decarceration and system transformation. So at the age of 17, I was sentenced to 20 to 40 years in New York State prison system. I served a total of 18 years, 11 months, and 28 days incarcerated. And during that time, I served a combined total of over 2 years of solitary confinement. But I don't want to really speak about myself and my experience. I want to speak about last month. I participated in an event hosted by MoMA PS1 that was advocating for the end of solitary here in New York. And I heard Chs and Doc Show. She is the founder and executive director of Blitz, a transgender woman. And she described how transgender women are subjected to solitary confinement because of their identity under the guise of protecting them. And I saw it happen throughout my incarceration, with my own eyes. And I was aware of this for decades, but because it was normalized, I didn't realize that this was unjust until K-Ann expressed that at this action. And that was a realization to me that this situation was unjust and should not be normal. And I don't have time to delve into the number of times I've seen people who clearly had serious mental health conditions placed in punitive segregation. But I would like to encourage the Board of Corrections to implement the blueprint for end of solitary confinement in New York City jails submitted by the New York City Jails Action Coalition and Hope Solitary Campaign, and to finally end solitary confinement in New York City. And thank you so much for hearing me speak.
Thank you, Mr. Mack. Very, very much appreciated. Our next speaker is Kelsey De Avila. Let's see, Kelsey De Avila. Good morning. Please begin when as soon as you're ready. Ms. De Avila? Can you hear us? It appears that you're not muted. Are you there, Ms. Davila? Okay. You're muted now. Now you're unmuted. Can you hear us? Okay. Seems that there is some technical difficulty. Are you able, Bennett, how can we help her?
I think maybe move on to the next one. We'll call her again.
Good deal. Okay. Jordan Rosenthal. Oh, wait. We now see, let's go back. It appears as though just saw. Okay. Can you hear us? Okay. We can't hear you. Say something. Okay. Hold tight. We're going to try to get to you and see if we can fix the problem. Thank you. Jordan Rosenthal. All right. Let's unmute Jordan Rosenthal. Good morning.
Good morning. Thank you so much. Can you hear me?
Yes, we can. Please begin.
Okay. Thank you, board, and for having this meeting and accepting public comment. It's always a pleasure to be in company with you all. My name is Jordan Rosenthal, and I'm the Director of Community Engagement for the Women's Community Justice Association. And today I'm here to talk about the end of solitary confinement, but also just a side note of the importance of visiting for people at Rikers. So specifically, I was really happy to hear DOC talk about earlier the re-implementation of barbershop and worship services in the pilot. But I feel like it's been a really long time since there has been movement at all talking about visitation and how important it is for families to stay together and stay into contact, especially when people are pre-trial, meaning that they're legally innocent. I really would, it's kind of it's more than kind of, it actually is a shame that the city has not moved forward with any type of visitation, and video visitation is not an acceptable way of ailing this problem, even as we've seen today in our WebEx thing, that there are technical difficulties that come up, and this is even more exacerbated for people who are currently detained. So I just really would like to see the DOC come up with a very comprehensive plan to reinstate visiting sooner rather than later, since the state has established that since, mid-August, and now we're in mid-October. So there's no reason for the city not to be moving forward with that. I also want to echo Darren Mack and what he was saying before about the in the disproportionate use of solitary or punitive segregation for transgender women and just women with mental health needs. We really need to end the practice of solitary confinement and limit it. There was an article that came out in the New York Times the other day that I'm sure most of us saw, talking about the disproportionate use of solitary and how the numbers keep on rising. Specifically, just so people know, the number of women who have been
Welcome to WebEx. Enter your access code or meeting number followed by
the number of women detained at Rosie's has actually increased by 50 since about early March, end of March to now. And I wouldn't be surprised if a large number of those women have gone through solitary confinement, especially as we're talking about COVID responses and solitary being used for medical.
I'm going to give you a few more seconds. Okay.
I appreciate it. Thank you.
Okay. Thank you. Thank you. All right. Let's see who is now. Let's see if we can get back to Kelsey. Are we ready for her?
Yeah, I believe she's on the phone now. Kelsey, can you hear us?
Hi. Can you guys hear me?
Yes. Thank you.
Oh, great. Thank you so much, Bennett. So good morning. My name is Kelsey Diablo with Brooklyn Defender Services. And before getting to my prepared comments, I first want to acknowledge Christopher Cruz. It was reported he died in custody at AMKC on Friday. And it's shameful not one person on this board mentioned his name or provided an update. And to that point, it's astonishing we come to these meetings and DOC and CHS are not being pressed on their COVID response. DOC represents a man who's been incarcerated for 2 months now. He was tested for COVID while in new admission housing and verbally told by a CHS staff member he would receive written results within 10 days. To this day, he has yet to receive those results. And he only assumes he tested negative because others in his housing unit weren't visibly sick. That was until, while in general population, a man he had been in close contact with, someone he had been watching TV with, they were working out together, had presumably tested positive in the housing unit. Now, the reason our client believes this man tested positive was because the CO in his housing unit made an announcement to everyone. The same CO also told our client to pack up this man's belongings without providing gloves, I might add. And our client and many others in the housing unit were asking questions of staff. They were anxious and were given no clear guidance from DOC nor CHS on next steps. Additionally, our client has a job that allows him to leave the housing unit, and with no information from CHS, he was in a position to either quit his job or continue and worry that he could potentially be positive and spreading COVID. Now, our client did call the CHS hotline after learning about a positive case in the unit. It did go to voicemail. He asked for a COVID test, and to this day, he has not been given one. There's no urgency on behalf of DOC nor CHS to answer the housing unit's questions or to test or to even quarantine out of precaution. Nothing happened. Advocates have been warning of the clear mismanagement of DOC and CHS, and here we have another example of a complete communication failure. And why is CHS not providing test results? Why is it that our office have to request their medical records and it's on us to tell a person how they tested weeks ago? People don't know what their test results say. They enter housing units not knowing if they are positive and if they could get others sick, if and how they should move around the facility. And these are basic questions that health staff should, without debate, be providing. And by not doing so, they are unnecessarily adding to the confusion, the frustration, and the tensions in these units. And it seems very much that communicating with people in custody is just not a priority. And for the defenders, we get simplistic responses from leadership that give no clarity or assurances that are prepared to safely manage an increase in positive cases. One of our biggest issues we brought to this board in March was about lack of information being provided. And now 7 months later, we're still coming to you with the same problem and asking for answers. So we call on this board to hold these agencies accountable and inform the public. Thank you.
Thank you. Meg, if we can follow up on the points that she has raised, I very much appreciate it. And thank you for reminding us that, we should have acknowledged the death. And,
can we get any information from the Department of CHS about the death today?
I'm sorry, Mr. Cohen.
Can we hear from the Department or CHS the cause of death?
I'm looking. I do not see if the board, is the board no longer with us? I mean, the department?
They were until Kelsey made the
disappear. And is CHS.
Hear me.
Good. Yes, thank you. Thank you very much.
Hello?
We can hear you.
Ah, good. The cause of death the manner and cause of death has not been determined yet by the ME.
Thank you. It's under investigation. We will bring that back. Thank you. Let's move on to move forward with Irene Sedano. Irene Sedano. All right, you're with us. Please begin.
Hello, everyone. Good morning. My name is Irene Sedano, and I'm a jail services advocate at Brooklyn Defender Services. The department continuously sidelines the experiences of people directly impacted. They continue to purport a narrative that ignores the numerous complaints provided by people in custody and our office. In my role, I speak directly to people in custody, both on the phone and through video, and what we're hearing are not isolated incidents, but a systemic failure across all DOC facilities. I want to share a testimony from a man I spoke to just last week at AMKC. They're violating us here. I live in a dorm with 45 out of 50 bed spaces currently filled. We're sleeping head to head with each other and only about 2 feet apart. While our unit is being searched, the entire dorm is packed into the day room, even though there are clear signs on the walls saying that only 15 people are allowed in the day room at once. When I told an officer that I was concerned about the overcrowding, he said, "We don't care about that. Social distancing doesn't matter anymore." I've had to use one disposable mask for weeks. Sometimes I miss my appointments to the clinic to get my anxiety medication because they ran out of masks, and I don't feel safe leaving the dorm without one. Every time I ask for a mask, they say they don't have any. Officers don't even wear them all of the time. Can you believe that we're sharing one bottle of watered down bleach between 2 dorms? They don't disinfect or clean anything. I only saw it happen once back in March. Now we have to put a sock over the phone because they aren't being cleaned. We just spent 3 days without soap and no one had answers. My anxiety is going crazy. This is one man's story, but there are hundreds going through the same experience. People in custody are saying the same thing across all facilities. During the city council hearing, Commissioner Brand stated that the department has expanded their robust sanitation practices and activated protocols to provide PPE to staff and individuals. She went on to say that DOC committed to cleaning and sanitizing all contact surfaces and phones every 2 hours and providing an ample supply of PPE to all people in custody. The chief has repeatedly stated housing units would be at no more than 50% capacity to encourage social distancing. Yet on Friday, the department posted on their Twitter account that they have thousands of beds and empty units not being utilized. If there's so much room, why does the department actively put people in units reaching max capacity? Their words in these meetings do not match their actions in the jails. We're months into this pandemic, and it's clear from the sheer number of complaints, the lack of concrete information, which is vague and contradicting at times, DOC is failing people in custody and their staff. We do not believe the department is capable to safely protect nor manage a second wave hitting the New York City jails. We call on this board to be a true independent oversight body and hold DOC accountable. Thank you.
Thank you very much. Meg, this is an issue that we just need to make sure we follow up on soon, like immediately. I'm going to turn the public comment period over to Felipe Franco. I'm going to drop and then pick up on my my portable technology. Okay. Thank you. Thank you.
The next speaker is Scout Silverstein.
Hi, can you hear me?
We can hear you.
Okay, great. Hi, my name is Scout, and I'd just like to put in a comment. I was incarcerated as a youth at age 16 for alleged possession of a controlled substance. I had already had involvement with Child Protective Services from the age of 13 and had clearly experienced trauma. When I was incarcerated, I was placed with adults and told there was no room in the adolescent block. I was given medication with no information or education around what they were giving me. At 16 years old, with a nonviolent offense, I was placed in the same block as sex offenders of children and murderers. I had asked to move blocks, and I was honored, but the cell I was moved to needed maintenance work, and I was sent back to my original block. The guards would watch as a woman who was on a 23-in-1 lockdown would come to my cell and bang on the windows, screaming that my mother didn't love me, and throw buckets of water under the door to flood my cell. At this point, I experienced some mental health deterioration. Because of my history with self-injury, I was stripped of all clothing, including undergarments, and placed in the green turtle suit, which is never washed, with other incarcerated people's body fluids on it. I was also placed on 23-in-1 lockdown for the remainder of my incarceration. I was sent to different residential treatment facilities after this, some of which are now shut down for abuse, endangerment, and murder. No child or teenager should be subject to 23-1 or incarceration in general, and children and adolescents should be treated with a social justice and trauma-informed therapeutic framework. Without this, no healing can happen, and recidivism is almost guaranteed. Additionally, I am a transgender person with epilepsy, and knowing that Layleen Polanco Extravaganza died in solitary as a result of criminal negligence on behalf of the correctional officers, I can only imagine what my experience would be today if I were to be incarcerated. As a person on the outside who writes with those on the inside, I want to echo that transgender people are at elevated risk for being segregated, assaulted, and discarded, and this is not acceptable. Thank you.
Thank you for your comments.
The next speaker is Sarita Daftari.
Sarita, you're on mute.
Yes. Are you able to hear me now?
Perfect.
Okay, thank you very much. Good morning, and thank you to the board members for this opportunity to comment. I'll focus my testimony today on two things: ending solitary confinement and the tragic death in DOC custody last Friday. Regarding ending solitary confinement, as board members tasked with the incredibly important power of oversight over spaces that are otherwise hidden from public view, I think you know what you must do. You must vote immediately to end solitary confinement. It is torture. It causes irreparable harm to people. In the years since the Jails Action Coalition has been pushing for you to update your rules on restrictive housing, over 8,500 people have suffered the torture of solitary confinement. I'll say that again. Over 8,500 people have suffered the torture of solitary confinement in the years since the Jails Action Coalition has been pushing for you to update your rules. In this year alone, over 900 people have suffered the torture of solitary confinement. This is reporting that was shared in the New York Times yesterday. At the beginning of the rulemaking process last fall, you've heard testimony from dozens of people who suffered back torture. You've also heard from other formerly incarcerated people who have told you that solitary confinement absolutely does not make them safer, but in fact adds to the violent environment of the jails by further traumatizing already traumatized people. This board does not need the agreement of a working group or COBA or DOC to move forward with utilizing your independent oversight power to end torture in New York City jails now. Regarding the recent death in DOC custody, I want to urge the board to conduct a full investigation into the death of Christopher Cruz, in addition to the full investigation which advocates requested last month into the death of Hector Rodriguez. The report that the board issued on the tragic death of Layleen Extravaganza Cubilet Polanco is likely the only reason that any staff were held accountable for their negligence that led to her death. It is one of the most important and necessary functions this board can fulfill to gather a full accounting of the events leading up to the death of any person in the custody of the Department of Correction, because people in custody are wholly dependent on correction officers and CHS workers for their care, even without the most basic freedoms that the rest of us can exercise to keep ourselves healthy and safe. Thank you for hearing this testimony, and we look forward to the vote on solitary confinement soon.
The next speaker is Anissa Sabur.
Anissa, can you hear us?
Okay, I can hear you. Can you hear me?
Yes.
Okay, thank you.
Go ahead, you have 3 minutes.
Good morning. Thank you again for holding this hearing and actively doing what an oversight body should do, and that's hearing from the public. My name is Anissa Sabur. I am the coordinator for the Coalition for Women's Prisoners. I am a HALT solitary confinement member, and I am a solitary survivor. And I'm here today to talk to you about solitary confinement and ending it in New York City. So it's been maybe a year now since the rulemaking, and it's a year and a half since we've lost Layleen Polanco. And they've said they would limit solitary, and it's almost 4 months since de Blasio said he would end it. Let alone, it's been 5 years, 5.5 years, excuse me, since the death of Khalif. We have the death of Bradley Bartlett 7 years ago, Jason Esoterica 8 years ago, and the list of tragedies go on. I listened to this meeting this morning, and I actually heard the Board of Corrections state they are still once again delaying the vote on the rules to end solitary. They didn't provide a definite date of when, and this has been going on for a year now. We're in October of 2020. In 2020 and 2019, the board said they would begin to do this work, right? Solitary is torture, and it must be ended now. We need the public to know when this voting is going to happen, and when these rules are going to begin to be implemented to release the pressure of those who are currently in solitary and those who have died from solitary. We need to honor those folks and their lives because they're human beings. I spoke at a rally on Sunday for Layleen Polanco. You know, this would have been her 20-something birthday. Young people, here we are. We got another young person in their 20s just this past week. We don't know if this person was in solitary. We don't know what this person died from. And we need the public to know what's happening on the inside. As the oversight body, it's your guys' job and ability to actually bring this information to the public. And we feel like you are like just weighing us away as people who have experienced this and know the torture that solitary brings to human lives. I am demanding that you give us some insight to what you're doing and when you're doing it. As someone who has experienced solitary, I know the torture. I lived through it. I know that officers do not care about people who are incarcerated. We need to make sure that every person detained is treated detainedly, not as somebody who's convicted and are put in cells, isolated by themselves, away from population, which would really be torturous to the psyche. I know for me, being in solitary confinement alone drove me crazy. And I say the word crazy because I saw dead people. I talked to dead people. I mean, all of the above. Nearly lost my life in solitary. This is in 1989. We're now in 2020. What is holding up the process? Stop it. We are human beings. These could be your children, your mothers, your grandparents. People who are contracting COVID, being kept in isolation without CSH actually making sure that they are tested and any kind of way of implementing any kind of medication or watch oversight that would actually make these people feel like somebody cares that they are sick and not just isolating them away from population alone, where officers are not going to act like nurses and doctors and staff who are medically trained, who can better understand what it is that's happening to this individual physically, spiritually, and psychically. So yeah, I need to know, when is the board going to make a vote on these rules, and when are they going to start to implement them?
Thank you. Thank you, Lisa. Thank you for your testimony.
Thank you.
The next speaker is Andra Clark. I don't believe this person's here. The next person is Claudia Forrester.
Claudia, can you hear us?
Hi, can you hear me?
Yes.
All right.
Go ahead, you have 3 minutes.
Good morning. My name is Claudia Forrester, and I'm a jail services advocate at Brooklyn Defender Services. And during the COVID-19 pandemic, I have been listening to the concerns of our incarcerated clients on a daily basis. I want to share their experiences with you and echo the comments shared today by formerly incarcerated people, their loved ones, and other advocates. For years, we've been coming to these meetings urging you to move forward with restrictive housing rulemaking. People have died while this board waits. This year is the closest we've come to the board voting, but alas, another excuse and another delay to ending the torturous practice of isolation in New York City jails. During the pandemic, the inhumane isolation of restrictive housing has only become more severe. Any programming has been canceled, in-person family visits replaced with screens, check-ins from mental health staff are limited to only the most severe cases. Across the board, I have seen our clients struggling with the intense effects of this pandemic, but especially those in restrictive housing. I recently spoke to a man who I will refer to as Mr. T, who was in ESH level 1. He had recently been moved there after being in PSEG for 30 days. Spending his few hours out of cell chained to a desk, Mr. T had decompensated dramatically since the last time I had spoken with him. Mr. T shared that to him, ESH felt worse than the box because he often doesn't get to go to rec and he has no idea how long he will be trapped in the unit. I urge the board to ban all use of restraint desks and set a minimum 14 hours out of cell for all individuals in DOC custody. Anything less is inhumane. Mr. T also shared that he had no idea why he had been in PSEG to begin with, or why he is now in ESH. As we commonly hear from our clients, while his paperwork shows that he refused his hearing, Mr. T was never even notified of a hearing existing. The board must include due process protections in these new rules for individuals facing any disciplinary hearing. For those who are being represented, their attorney and defense office should have the right to take part in these disciplinary hearings. Defenders across the city have all agreed to take on the additional responsibility this holds. DOC routinely flaunts the due process violations because it's done behind closed doors where people in custody are held at a disadvantage, and DOC can carry on with no accountability. Solitary confinement, and by any other name, is torture. It causes irreversible harm, and limiting out of cell time does not in any way contribute to greater safety or reductions in violence. We must implement strategies that not only keep people safe, but uplift them. We must not resort to old ways of thinking that only continue the violence. No more delays, no more excuses. We must end the torture of isolation, and this board has the power to right the wrongs of this city. Thank you.
Thank you.
The next speaker is Minister Dr. Victoria Phillips.
Hello?
We can hear you.
Can you hear me?
Yes.
Yep.
Yes, sorry.
Good morning, everyone. Let me bring this up. Peace and blessings. My name is Minister Dr. Victoria Phillips, Ms. V. I'm a Jails Action Coalition member and Justice for Women Task Force member. In addition, the founder of Visionary V and a community health justice organizer for the Mental Health Project Urban Justice Center. I'd like to state on the record that the Board of Corrections budget should not have been cut, especially during this pandemic. Instead, the Department of Corrections should have had their budget cut, and those funds should cover the entire BOC budget, if not more. The Federal Monitor, the Nunez reports, all have shown a direct need for continued and expanded independent oversight and supervision because DOC is not capable of holding themselves accountable. I'd like to address several things. There is no way that 1,437 DOC staff and almost 250 of CHS staff are COVID positive, and there are 0 cases of COVID in New York City facilities within the population. Yet I have recordings stating that entire units being exposed to those with COVID are high levels of antibodies that the CHS doctor stated they must have just had COVID after May 19th, the end of summer to be exact, because Brenda Cook today stated that no one in the system, not new, has tested positive since May 19th. Again, how many have been tested out of those before May 19th? How many have left and died since because of COVID? Who were they housed with and how have they been tested? I have a recording this summer where a young man is telling me about a man who died of COVID and slept 3 beds away from him. and how in that same unit they would even sleep on the floor attempting to get a bit of air in the summer heat. So doesn't COVID spread in bad ventilation? And at the last meeting, DOC stated on the record that they bring 40 masks per housing unit. What about the units with people above that number? And what about masks that might be defective? Are they accounted for when they bring that 40 mask supply? Brenda Cook also mentioned several things being worked on but not yet worked through. DOC is still working out religious services, which will start to roll out by 10 people next week. That is what they said at last month's meeting, minus the number of people. Meanwhile, real people are suffering. We do not need another rollout story, but a real date and time of action. People are unable to visit their loved ones, go to court. There's no paper or even stamps at times in commissary so they can write. Losing loved ones and unable to go to funerals and unable to just have a person to share their own personal thoughts with. Wow, how barbaric are we? We lock up human beings and expect them to become superheroes. They need spiritual guidance and a safe individual in which they can seek mental and even physical refuge. How many times has clergy notified medical that someone was in a unit and had an emergency medical concern that was not being addressed? Mental health was not seeing those in custody enough prior to the pandemic, and now their only safe outlet, clergy, has yet to return. Never forget, it was the commissioner who was ready to remove clergy out of the facilities last year, and I was outreach to shed light on that need to keep clergy in the facilities by DOC uniformed staff. And let me be clear, the public has every right to hear what is being discussed. And let me give a clear example. As an advisory board member for the adolescents and young adults and then the adults, the same advisory board that board member Perello mentioned being on and praising Torres that works at DOC for the changes implemented. We, the public, the defenders, the social workers, and even people like me who have worked behind the walls were a part of every step to make sure those changes occur. We all took part in developing many of the things Commissioner Brand often mentions that DOC has done. Not one of those things ever mentioned advocates, aka the public, did not take part in pushing to occur at every level. Let us not overlook or ignore due to a lack of full understanding of what has previously occurred so that we can all move forward in a safe manner for all constituents in New York City, whether incarcerated or not. Lastly, this board must keep oversight until all DOC staff is off any ACS site. Administrative tasks keep the facilities running, and until DOC moves off-site completely, it is the responsibility of the Board of Corrections to stay abreast and make sure that all things that DOC is doing is up to par. Everyone have a blessed day.
Thank you.
The next speaker is Darlene McDay. Don't believe is here. The speaker after that is Danielle Gerard.
Hi, yes, can you hear me?
Yep.
Go ahead.
Thank you, Chair Jones, Austin, board members, and Ms. Egan. My name is Danielle Gerard, and I am a senior staff attorney at Children's Rights. I have testified you before most months for several years. Children's Rights is concerned about the welfare of young adults and youth incarcerated in the city's jails. Thank you for the opportunity to speak today regarding restrictive housing rulemaking and solitary confinement. We thank you again for committing to publish new restrictive housing rules within 10 days, with 10 days notice to the public and advocates, but we are troubled about the delay and what it may mean for young adults and solitary confinement. We believe that the proposed rules should require the Department of Correction to abolish certain practices immediately. In addition, we remain concerned about the future of the young adult plan. First, solitary confinement is torture. The proposed rules should be amended to abolish solitary confinement outright. As a member of the New York City Jails Action Coalition, Children's Rights supports the coalition and the Halt Solitary Campaign's blueprint for ending solitary confinement in New York City jails to end this barbaric practice. Second, other forms of restrictive housing must also be abolished. The department's continued reliance on ESH and the secure unit presents a serious problem. As we have testified repeatedly over the years, when young adults are placed in ESH and the secure unit, they are isolated from beneficial contacts, especially the few existing normalizing activities available in detention. The same thing is true for separation status housing. Third, in the 2019 draft of the rules, shackling young adults to desks will be permitted until March 2022. There is no reason to wait that long to end this cruel and inhumane practice. It should no longer be permitted in enhanced supervision housing in the secure unit or anywhere else. Finally, it does not appear that either the board or the department has a current plan for allocating resources for management, officers, training, programming, and schools for addressing the needs of incarcerated young adults. In addition, there does not seem to be a comprehensive plan in the works for this vulnerable population after Rikers closes. For example, how are you going to guarantee all of these things to young adults scattered among the 4 borough jails? Children's Rights remains deeply troubled about the lack of a plan and calls on the board and the department to develop one that truly and immediately addresses the needs of incarcerated young adults, including abolishing ESH, the secure unit, and separation status housing. These are all tantamount to solitary confinement, which has no place in the city's jails. Thank you.
The next speaker is Julia Solomons.
Hi, can everyone hear me?
Yep, go ahead.
Go ahead.
Yes.
Okay, thank you so much. My name is Julia Solomons. I'm a social worker and policy advocate with the Bronx Defenders. Thanks so much for the opportunity to speak today. Before beginning our comment, I do want to ask that in future meetings, the board require both the department and CHS to remain in the meeting until the end of public comment in order to respond to urgent issues raised by the public, such as a recent death in custody. Not being present to respond to board members' questions regarding information shared by the public allows these agencies to further evade accountability and is unacceptable. Today, we focus our attention on one particularly troubling issue, increasing density in the jails without any encouraging response from the department. In Bronx arraignments, we're seeing more and more judges acting as if the COVID crisis is over. We're seeing an increase in bail being set on qualifying offenses, taking zero consideration of our clients' economic status, thus ensuring that those who cannot afford bail remain incarcerated as they await their trials, despite the backlog of trial-ready cases and subsequent delays in trials. Media outlets such as the New York Post are pushing a scare campaign about supposed rising crime rates because it draws clicks and sells papers, but this story about New York falling into chaos is extremely harmful. Our clients in the Bronx, the poorest congressional district in the country, suffering more and more financially as the economy shrinks under the pandemic, will be harmed the most. AMKC 4 Upper, as reported by one of our clients, is at almost 100% capacity, and at the same time, OBCC and MDC are closing. We support closing these jails, especially OBCC with its lack of air conditioning and particularly poor conditions, but wonder how the department plans to keep density low in order to prevent COVID surging once again in our jails. They have touted low density dorms for 6 months now as the solution to the public health crisis. But how do they explain the situation at AMKC, as well as what we heard today that nearly all of the dorms are beyond 50% capacity? The department responded that they have thousands of beds available in closed housing units, but this begs the question, why then have they forced people currently in custody to live in crowded dorms if they have so many open beds in closed units, knowing that the jail population is increasing? This is highly concerning, particularly as we move into the second wave of this pandemic. DOC tweeted recently that they've had 0 transmissions since May and reiterated that this morning, but a client of ours reported that he just contracted COVID and he's been at Rikers for months. We share this to highlight once again the disconnect between what the department shares publicly and what we continue to hear from our clients in custody. We value our clients' safety above all else, as well as the safety of department staff, and we see a huge warning sign in these boasts of 0 transmissions. How long will these low numbers last as the population keeps rising? DOC and CHS reports today do not indicate any plans to increase precautions as cases rise in the city. Notably, they have no plans to test staff more regularly, and given the consistent lack of PPE compliance among staff, we are very concerned about the safety of our clients and are frankly dismayed by CHS and DOC's COVID response reports this morning. Finally, we are disappointed by the continued delay of restrictive housing rulemaking. Each day that restrictive housing continues is another day our clients are being tortured. In hearing that ESH will be recreated in another facility with the closure of OBCC, we remain wary of whether real change is actually imminent. We very much hope that the rule that's issued reflects the years it has taken to come to fruition and accomplishes everything the board has promised: a complete and total end to any form of isolated confinement, a move towards true procedural justice and due process, and a shift from a punitive to a rehabilitative model. Yet if we are so close to making these major changes, why recreate such a harmful and punitive practice as ESH? We reiterate our support for implementing the blueprint to end solitary confinement in the proposed rule, as well as implementing access to counsel in disciplinary hearings. Only by facilitating relationships with counsel for people in custody and DOC staff will we actually reduce violence in the city jails. We support creating pathways of connection between isolated, neglected Rikers Island and the community, and that starts with access to counsel in disciplinary proceedings.
Thank you, Julia.
Thank you.
The next speaker is Kayla Simpson.
Hi, can you hear me?
We can hear you.
Okay, wonderful. My name's Kayla Simpson. I'm a staff attorney at the Legal Aid Society's Prisoners' Rights Project. Good morning. I'm also going to start by acknowledging the heartbreak of the death in custody of our client, Christopher Cruz. And I want to just say it here. He was 27 years old. He was a father. He was a son. He was a brother. And his humanity was not acknowledged today in this meeting. When pressed, the only agency that remained on the line could only say that they didn't know his cause of death. And that's just unacceptable. His family deserved answers. The community deserves to know what the city's actually going to do in the wake of yet another death in the city jails. His life matters, and so does everyone else he leaves behind in the cages run by the city. Which brings us to COVID-19. I'm not going to repeat the points that a lot of my colleagues have made here today, but the tone of this meeting today just didn't reflect the reality of the ongoing threat. And once again, we see the difference in how we treat people in the community. For example, this meeting is still virtual so that we can all protect ourselves with the risk that we assess. We cannot understand DOC's approach to masks and housing density. And as Julia just mentioned, you know, the department didn't answer Mr. Perrino's question about why, if there are so many open units now and there's nothing to see here, why we keep hearing clients saying, and the board keeps reporting about the units rising in capacity above 50%. You know, we've heard multiple reports in the last weeks from people in different dorms who are saying that they are close to full and they are terrified. And their terror is not reflected here today. There's no evidence that the department is on top of this. The vague assurances today are unacceptable, and we need to do better to protect people. And I also want to focus on masks again. I know, and I appreciate Dr. Cohen mentioning that the mask compliance that he saw was a little better. But just look at the contrast between what CHS and DOC have said in public pronouncements about masks. Dr. Yang made very clear before the New York State Senate, CHS staff are required to wear masks. People are subject to discipline if they don't comply, period. They reinforce that with DOC, especially in medical clinics. She says they are wearing masks. And DOC, by contrast, sort of equivocates, right? At one point they said masks are recommended. The next moment they said they're mandatory. They have a policy that includes a nonsensical framework that masks are only required when you're within 6 feet of another person and makes no commitments about whether someone will be disciplined, only that they might. This is terribly reckless. Again, I feel like I have to say, this is where people are forced to live. Scientists talk about the risk factors. Well, think about jails. The poorest of ventilation system, unrelenting exposure 24 hours a day, rotating staff. It's not just new admissions, it's staff, rotating 3 shifts a day. And there's just no comparison to this type of exposure in the outside world. This is not like walking by someone in the grocery store. And public health experts could not be clear about what we need to do. We need to wear masks. We need to socially distance. And we're risking their lives by not taking this more seriously right now. Community prevalence is low. And so thankfully, prevalence in the jails is probably low. But we cannot rely on that in this moment of risk where we still don't feel safe enough to
Thank you, Ms. Simpson.
Thank you.
The next speaker is Zachary Katz-Nelson.
Hello, good morning. My name is Zachary Katz-Nelson. I am the Policy Director at the Libman Commission, the Independent Commission on New York City Criminal Justice and Incarceration Reform. Thanks for the chance to testify today, and thanks for holding this hearing. A few notes. First, on solitary, we are, of course, grateful for the efforts the board has undertaken so far for the Vice Chair and for others on the staff. We look forward to the rules that are going to come out. We are concerned that obviously there is delay. We very much hope the board is going to be able to meet the October deadline that is set, and appreciate, of course, that the rules will be released 10 days in advance of the vote. It's not quite clear that that gives enough time for the public to actually weigh in and for the comments to be considered and hopefully some, if relevant, adopted by the board into the rules. And we think that that's a necessary part of this process. But first and foremost, solitary must end, and we very much hope that the rules will implement that. I wanted to comment on the issue of the rising population in the jails and this issue of density in the dorms. And it seems that the one thing that has not really been discussed is more decarceration. That was something obviously the city was prioritizing in the early days of the pandemic, and the 6-day program, which Dr. Cohen and others have talked about. This is the second meeting in a row where the board has asked the department for information on how many people have been released under 6A in the last couple of months. And for the second time in a row, that information was not forthcoming. We urge you to please push. This is a program that is proven to work. It is proven to keep people safe in terms of the general public. It's proven to help the people that are being released in far more significant ways than is possible within Rikers. It is vastly cheaper than Rikers. It is a win-win for this entire city if we can get more people out through the 6A program. And we urge the board to continue to press the department to actually use its authority that it has to release people from the jails. And I would just close by echoing the comment that of Ms. Aftery earlier about investigations into the deaths in custody, and very much hope that the board is able to pursue that as well. Thank you so much.
The speaker is Candy.
Hello.
We can hear you.
Okay. Hello, my name is Candy. I'm solitary survivor. I use the alias solitary survivor because being in solitary confinement is about survival of the fittest. Obviously, I don't know how I'm here today speaking. I owe it all to God because I try to kill myself every day in solitary confinement, and solitary is absolute torture. I don't understand why de Blasio, who has an African-American son and always talks about his biracial son, was not in solitary confinement. De Blasio talked about a conversation that he had with Dante, his son, as to how young Black men should act around police officers to prevent being the target of violence. But what if Dante was forced in solitary confinement? He also stated, I've been raising a Black son in America, and I've had to have very, very serious talks with Dante about how to protect himself in the streets of our city, including the fact that he has to take special caution because there have been too many tragedies between young men and our police. Again, I ask, what if Dante was forced in solitary confinement? What would Dante do to quote unquote protect, unquote, himself from the stress of solitary, the depression of solitary, the torture in solitary, the lack of mental and physical health in solitary, being sexually abused in solitary? He then went on to say what parents have done for decades who have children of color, especially young men of color, is train them to be very careful when they have a connection with a police officer, when they have an encounter with a police officer. It's different for a white child. That's just the reality in this country. Once again, I ask, if Dante was forced in solitary confinement, how would he be able to How would he be able to not want to commit suicide? How would he be able to go to his visits if he's cuffed inside of a cell and can't even get to a visit? How would he be able to eat if he's being denied food? How would he be able to have visits with his family, visits with his attorney visits, legal visits, if he's in solitary? Because I was denied all of the above. This has to come to an end. How many more lives does it have to take? Khalif Browder should have been enough, but now we have Layleen Polanco. What more does it take? And I keep saying, I'm speaking, I'm here, I'm physically here, but emotionally, spiritually, and mentally, I'm destroyed. I'll never be the same. I hate the world. I hate living. If this is called living, I might be alive, but I'm not living. What does it take to end solitary confinement? I tried to commit suicide every day in solitary. And what did they say? Oh, we have 8 hours until the body is cold. And that's exactly what they did to Layleen Polanco. They were opening the door and laughing and closing the door and laughing because they had 8 hours for that body to get cold. You owe it to all of these people who have passed away in solitary. You owe it to their families to at least end solitary confinement. I'm so sick and I'm begging you to end solitary. I'm not asking, I'm begging. I'm pleading from the bottom of my heart to please end solitary confinement. It's not right. It's torturous. There's no cure for nightmares. I don't even sleep sometimes because I'm afraid that if I go to sleep, I'm going to have a nightmare of being in solitary. Let alone sometimes I think I'm not free. Sometimes I think I'm in a dream and that I'm not free and I'm going to wake up back in solitary because it's a nightmare. It's a torturous nightmare that never ends. Yes, I'm quote unquote free. I'm free from behind bars, but mentally, spiritually, emotionally, I'm not free. I hate Department of Corrections. I hate NYPD. And I'm really starting to hate Cuomo, de Blasio, and anybody else in charge of ending solitary confinement. It has got to come to an end. If you have a heart, a soul, or if you believe in God, you would end solitary confinement. Not today, not tomorrow, but as of yesterday.
Thank you, Candy.
The next speaker is Eliel Cruz. Don't believe is here. Next speaker after that is Elizabeth Baldwin. We don't believe is here any longer. Next speaker after that is Tanya Krupat, who I don't believe is here any longer. And then the speaker after that is Francis Catella Shapiro. Francis, if you're here, could you raise your hand on the screen? There we go. Cool. You should be able to speak now.
Okay, can you hear me? I wasn't sure I was supposed to be the next speaker because of that long line. I'm still muted, so
we can hear
you.
We can hear you. Oh, okay. Mostly I am here today to address, as some other people have done, the absolute urgency around the need to do something to end solitary confinement. You all were working on that, and then when the mayor appointed this little committee, you've sort of surrendered your authority in the situation, waiting for them to come up with some sort of plan. We know that solitary confinement destroys people. It destroys their minds. It probably also destroys their bodies. And for you to let it continue while some authority is trying to say, no, we know better, we'll come up with the rules. We had originally, I'm with the whole solitary campaign, and I've also been working to some extent with the Jails Action Coalition, and we submitted to you the blueprint for how to end solitary. You started to work on that, and now everything has been simply turned over to this other body, in fact, a body which includes the people who've been the supporters of solitary. So it is very difficult to understand how they are going to come up with a good set of rules. And what we've seen instead is this system of delay. Originally, they were going to submit their policies in September. Then they were going to submit them, we understood, by this meeting. But so far, we have seen nothing. And I'm really here to urge you to reassert your authority in this situation and make sure that solitary confinement is ended as soon as possible. And one aspect of that, since a big issue seems to be the need to retrain the corrections officers, why doesn't that start now? Why aren't they being helped to understand the necessity for different protocols, for different ways of dealing with problems, and give them the skills that they're going to need in order to make those changes effective? I mean, you've heard from so many people about how horrible the conditions are. And I was at that demonstration on Sunday that somebody mentioned before, in which quite a few people talked about their experiences in solitary. And the stories are just so horrific. That has got to end. So please do everything you can to make sure it ends now. It's urgent. Thank you.
The next speaker is Brad Maurer. Brad, if you're still with us, could you raise your hand on the screen? There we go.
Hi, can you
Hi,
hear me?
Brad. You have 3 minutes.
Hello, I'm sorry, can you hear me?
We can hear you very well.
Okay, great, thank you so much. I want to address this approaching sort of perfect storm that we have right now of sort of letting our guard down, advancing wrong-headed policy, and then of course the surging infections that we're seeing across the city and surrounding areas. I mean, the fundamental numbers are already moving in the wrong direction. We're seeing significant transmission increases across the city in various places. And we know that local jails reflect and then severely amplify infectious disease trends. The new admissions, the overall jail population, and housing density are all way up, as the board is well aware from its own data. And we know dorms are much higher risk, for example, yet 2/3 of dorm housing is currently above 50% capacity. The combined number of people serving city sentences with no other holds or in on technical parole violations with no other holds remains in the hundreds. There's still zero routine testing for COs, despite enormous CO infection numbers during the first jail outbreak. And every single one of these trends is a choice. We have the tools and the historical precedent to mitigate them. We simply aren't doing it. And now, of course, we come to the issue of closing MDC and OBCC right now without a clear plan in place. And that's very likely going to exacerbate these already troubling trends. This density could, which is already high, could reach pre-pandemic levels. The new admissions protocol, which is often touted as a critical containment measure, is going to be completely upended. How can new admissions be properly separated from each other and from the existing population? What are the current testing refusal numbers? We know they've been very high throughout the pandemic. And after MDC and OBCC close, how can there be enough space to medically isolate for 2 full weeks those who refuse testing? What we found out from DOC today is that with respect to this closure announcement, there is currently no plan in place to deal with several critical issues that DOC and CHS have been talking about for months as tentpoles of their COVID-19 strategy. There haven't been those discussions. That's what the DOC told us today. With respect to testing, why are we still hearing that regular testing of COs would have no benefits? If I heard correctly, this was CHS's response to the board's question about CO testing. If CO testing would have no benefits, why are we bothering to test new admissions? Why is DOC touting the availability of testing for staff? Back in May, Dr. McDonald promoted a preprint study on Twitter, which concluded that twice weekly testing for high-risk workers was the minimum frequency to help reduce transmission in those settings. Our nursing homes took heed of this sort of research. Our jails have not, despite sharing many of the same risks. DOC staff positives to date have been almost 3 times the number among the jail population. So reducing transmission from COs via routine testing seems like it would have a whole lot of benefit. Not to mention my office's recent experience with mask compliance by COs has been very underwhelming, to say the least. And then why aren't the jails doing rapid testing? Dr. McDonald and other CHS personnel have publicly advocated for cheaper and more frequent rapid testing rather than slow, expensive PCR tests, which would allow for truly aggressive testing of both incarcerated persons and staff. Why hasn't this happened? Why isn't there a plan in place for this to happen? Why aren't there discussions about doing this? And if these public meetings were yielding thoughtful discussion and transparency regarding what the jails are doing and why, that would be one thing. But what we're seeing instead is dismissive attitudes about legitimate questions and concerns. And we're seeing facility closure decisions being made before the COVID-related consequences have even been discussed internally, let alone publicly. So I'm fearful for the impact that this reckless approach is going to have on our clients and on the city as we enter a very dangerous fall and winter.
Thank you, Brad, for your testimony.
The next speaker is Jennifer Parrish.
Hi, can you hear me? Hello?
Yes, we can hear you.
Oh, thank you so much. Good morning. My name is Jennifer Parrish. I'm the Director of Criminal Justice Advocacy at the Urban Justice Center Mental Health Project and a member of the HALT campaign and Jails Action Coalition. I'm speaking today to express my outrage that the board is meeting yet again without presenting its proposed rule to end solitary confinement. Despite the assurances of Board Chair Jones-Austin and Vice Chair Richards, who is notably absent from this meeting, the working group has shown itself to be exactly what we feared, merely a tool to postpone making real change in solitary confinement. As New York Times reporting shows, Commissioner Brand has failed to reduce solitary confinement on her own. In fact, the percentage of people placed in solitary confinement last year actually increased. The COBRA president shows no change of heart, still promoting solitary as a way to address violence, even in the face of evidence that shows it does not work. Clearly, only action by this board will bring about the end to solitary, yet you continue to delay. The discussion at this meeting between board members and the department about facility closures suggests that as the department is making decisions about the way it functions as a whole, it is not working in concert with the board to end solitary and develop alternatives. Contrary to the assurances we received previously, the working group still has not completed its recommendations. None of the steps that must be taken before the board's vote have happened. The board's rulemaking committee has not even had a chance to review the working group's recommendation. It is laughable to think that all the steps enumerated by the board chair at the beginning of this meeting can happen by the end of October. Had the board moved its own rulemaking process forward without deferring to the sham working group, the vote could have occurred already. This board should be ashamed that during the year it has postponed ending solitary confinement, more than 1,700 people have been subjected to this torture. Your delay has real-world consequences to thousands of people. The members of this board must stop deferring to this working group and demand that the chair move this process forward immediately. I also want to note that since the last board meeting, yet another person has died in DOC custody. Yet there was no mention of Christopher Cruz's death at this meeting until advocates were allowed to speak. The board should have provided some information about the circumstances about Mr. Cruz's death at the meeting. I urge you to investigate it and publicly report your findings. It's imperative for the board to determine the circumstances of his death and put forward recommendations to prevent future deaths. One of your essential functions is to promote transparency in the operation of the city jails, and public reporting on death investigations is critical. I hope the board will follow up with the department about its plan to close Manhattan Detention Complex and OBCC. The department's decision to close GMDC was never satisfactorily explained, and it had significant detrimental impact on the young adult plan. Looking back at it, perhaps it was the department's strategy to circumvent the young adult plan. The board should make sure that the closure of MDC and OBCC is not designed to thwart efforts to end solitary confinement, or merely ill-conceived and will inadvertently hinder the success of implementation of that effort. Thank you for this opportunity to speak. I appreciate that Mr. Franco, Ms. Sherman, and Dr. Cohen respect their commitment as board members and remain in this meeting to listen to public comment. The entire board should value this part of the meeting and demonstrate that by remaining for this part of the meeting. Thank you.
Thank you, Jennifer.
I believe Tanya Krupet has been on the line and is now here.
Can you hear me now?
Yes.
Yes? Okay, sorry. Okay, thank you for the opportunity to speak with you today. I want to acknowledge the powerful testimonies before mine and the courage of the survivors like Candy and Anissa who share their personal experience. I join those calling for answers to the recent death of Christopher Cruz and calling for the end of solitary confinement. I also agree that DOC and CHS as well as BOC members should remain at these meetings until public comment is over. My name is Tanya Krupet. I'm the director of the Osborne Center for Justice Across Generations. I'm also a member of the DOC Visiting Working Group, although I'm not testifying on behalf of the work group today. My testimony focuses on visiting, and my written testimony includes details about televisiting as well. While it is positive that DOC mentioned earlier today that visiting may come back in a minimum of 2 weeks, I have many questions about how pre-registration will work. The state docs originally proposed this as well and then dropped it after hearing from many visitors and advocates that this would be problematic on many fronts. I urge DOC to consider input from visitors and advocates and not develop a visiting plan in a vacuum. Input is critical to an effective and successful reinstatement of visits. There have also been months and months in which DOC could have been working on a visit plan. I urge you to work with DOC to reinstate visits by the end of this month. Visiting at the city's jails has been suspended since March 18th, 7 months ago, and it has felt like silence about this significant aspect of DOC operations. Pre-COVID, DOC processed 500 to 700 visitors per day, 5 days a week. These are people's children, mothers, husbands, aunts, grandmothers, family members, and friends who are concerned, often sick with worry, and provide support to those incarcerated. While suspending visiting was necessary during the height of COVID, visiting must be reinstated and can be managed now with mandatory mask wearing for staff and visitors, social distancing and PPE in place, a revised visit schedule, and details made available to the public on the DOC website. Until this morning, the response regarding visiting reopening is that DOC is awaiting guidance from DOHMH. This is not an acceptable answer after so many months, lower infection rates, and the state prison system reopening visits in early August. The DOC website does not include any information about when visiting might resume, despite it saying that that section will be periodically updated with additional information. It appears not to have been updated since April. Osborne Association, along with Our Children, has been contracted by the Mayor's Office of Criminal Justice to provide in-person and video visiting support to mothers at Rose M. Singer and their children. We've been working with DOC and MOCJ to implement this project and hope to demonstrate that through this effort that in-person visits can be done safely and are worthwhile. We have requested permission to coordinate some in-person visiting events to get started. Implementing visiting in the time of COVID actually provides an opportunity to re-examine what visiting looks like in many ways that were needed anyway. The sheer volume of visitors processed by individual staff was untenable in terms of ensuring a positive visiting experience, and visitors go through too many checkpoints, interacting with many officers along the way. Now with COVID, there's another incentive for reducing all these contacts. We ask that DOC work with CHS and representatives of those who visit and who work in visiting, as well as the DOC Visiting Working Group, to develop an updated visiting process that would allow for reopening of visits while minimizing risk. We also ask you to look into the current DOC practice of strip searching individuals before and after televisiting. This is very disturbing, and data should be collected on how often and why this is happening. Thank you for your time and consideration.
Thank you.
The next speaker is Kelly Grace Price.
Hi, good morning. This is Kelly Grace Price. I believe I'm unmuted. Can you just confirm, please?
Yep, go ahead.
Okay, great. So I want to start off by in the chorus of people who have commented on the death of Christopher Cruz. Rest in peace. The last time we had 3 deaths in an 18-month span on Rikers Island was in the late 70s. And that spate of mysterious deaths that were labeled as hangings, but a lot of people believe that they weren't suicides, was investigated thoroughly, brought about public outcry, and forced the city of New York to change the BOC charter. That's the last time we had as many deaths in custody in 18 months. So I would like to reiterate what previous advocates have echoed. It's shameful that no one on the board or the department mentioned the death of Mr. Cruz before advocates did, and I would like the board to make this a priority. I also want to add that the board is in fact abdicating its responsibilities by farming out the rulemaking, writing, and editing process to the quote-unquote working group. The BOC charter specifically gives the power to the board members to dispatch these duties. And on the same vein, the BOC charter specifically gives BOC members the exclusive right to design, plan, and produce new jail facilities. But I don't see the board participating at any level in the planning and designing of new jail facilities. Cohen, I'd really like to see you try and wrestle back some of that authority. You shouldn't be asking the Department of Correction what's happening with the jail rebuild. And you should be the one making those decisions. And finally, I don't know how much time I have left, but I would like to bring up that the department, its PREA reporting has not just been abysmal, but it has been blatantly fraudulent and negligent in presenting the data that is mandated under New York City Council Local Law 33 and also under the PREA rule itself that mandates semi-annual reports. I want to just add as an example that in the calendar 2019, there were allegedly 147 incidents of staff on inmate sexual abuse and harassment reported. That's according to the February 15th, 2020 BOC semi-annual report. The Department of Corrections annual report on sexual abuse allegations that was just released earlier this month claims that there were 104 allegations of sexual abuse of an inmate by staff in calendar year 2019. So if you subtract those two numbers, you assume that there were 43 incidents of sexual harassment, right? Because if there were 104 incidents of sexual abuse in that time period and 147 incidents of abuse and harassment, we should have 43 incidents of sexual reported in calendar year 2019. But the Board of Corrections own sexual abuse and sexual harassment minimum standards 540 assessment report that was released in August 2020 reveals that there were in fact only 4 incidents of sexual harassment in the first part of 2019. And then the earlier sexual abuse and harassment report released in February claims that there were 30 reports of sexual harassment in the latter half of 2019. That's only 34 reports of sexual harassment. But there should have been 43 reports of sexual harassment. So if you're following this, and of course I'll turn in my detailed analysis of the reports that have been proffered by the department and the board, but if you follow this, there are 9 incidences of sexual harassment that just disappeared from the books in 2019. And this kind of data inaccuracy is rife throughout all the PREA reporting. I'd like to know who has been given the mantle to steward accuracy in reporting, and I would really like the board to heed my requests to make sure that PREA is implemented properly and we're getting good data before it moves on to rulemaking on restrictive housing. We cannot have this kind of dismembering of community rules and non-implementation of community rules still outstanding when we're trying to move forward to new rulemaking. Thank you very much for letting me testify today, and I will submit my written testimony.
Thank you.
Our last speaker is Melania Brown. Melania, if you're there, could you raise your hand on the screen? Gotcha. Should be able to speak now. Melania, are you there with us? We can't hear you. I think might be an audio issue on your end. I'm going to put you back into attendee and move you back to panelists and see if that might work.
Hello.
Oh, there you go.
Hi.
Please go ahead. You have 3 minutes.
Yes, hi. Hello, everyone. My name is Melania Brown. As many of you may know, I am Laylene Polanco's sister. My sister, Laylene Polanco, died last year in solitary confinement. She was placed there over the objectives of the medical staffs. I literally watched the video of my sister while the correctional officer stood by and watched as she took her last breath. And now it's very upsetting to me that the mayor made a comment to end solitary confinement using my sister's name, and yet nothing has been done. The votes are being pushed. No, people are not able to vote, and you guys don't know. You guys keep postponing it, and now we don't know when this will be able to happen. Like, enough is enough. A lot of people are right now suffering as we have in this meeting. I mean, how many more humans have to die? How many more humans have to suffer? Why isn't there other things in place? There should be maybe more mental health programs in place instead of solitary confinement. It is inhumane and it does not help a human being. You can't cage a human being for 23 hours a day and then expect to release them into this world and expect for them not to end up right back where they started. It makes no sense. I mean, a lot of things need to change. I'm against new jails because honestly, it's just torture. So I'm completely against new jails. But the jails that you guys do have, these humans, they're humans. They belong to someone. I don't care what their background is. I don't care what they're done. They belong to someone. My sister was my human. She, instead of being home with me today, I carry her around in chains. She's around my neck. It makes no sense. I go out there and I have to relive my sister's death over and over again. I'm getting broken promises from the mayor, okay? Getting my hopes up high. And then when it comes down to it, it's getting prolonged. So he lied to me. I mean, if you guys are humans, I mean, I am suffering through my sister's pain, and there's many other humans out here that have lost loved ones, and there's ones behind those walls that are suffering right now. It's not okay. It is not okay, and I really do hope that the mayor and you guys really please find a heart to end this, because it needs to end. It makes no sense. I don't even know whoever idea was for solitary confinement. They should be in solitary confinement. How many more loved ones, how many more people gotta die? How many more people gotta suffer? How many more people gotta get abused and raped and killed for this to end? Like, I mean, my sister, like, videos were released of correctional officers laughing as she took her last breath, when their job was supposed to be to go check on her. They stood there and watched my beautiful sister, all right? They watched my beautiful sister die. They watched her take her last breath. My sister was vibrant, full of life. She did not deserve what happened to her. And there's no justice for my sister. And so solitary confinement is done because that's where she took her last breath. There's no amount of money, no amount of paperwork that you guys can do that will ever bring her back. But ending solitary confinement and making sure that another loved one does not go through what we're going through. My family, they gave us a painful life sentence that we have to live with. And this is not okay. This is not okay. I'm against it, and I'm going to continue to fight until our voices are heard. Like Christopher Cruz, there's no information. And the same exact warden that they released, it was the same exact thing they said on my sister when my sister passed away in Rikers. It's like an automatic system. It's like these are not humans. They're not even being taken care of as even animals. They're not even property. They're nothing. And this is not okay. And I'm going to continue to push forward with my job and with what I'm doing because this has to come to an end. And thank you so much for hearing me. And I hope you guys do find a heart to end solitary confinement. Thank you.
Thank you, Ms. Brown. Bennett, we're done with testimony.
Yeah, that's the end of the speakers.
I think Bobby wants to say a few words.
Yes, I'm not going to respond to all the extraordinary eloquent testimony we just had, but just a suggestion to the fellow board members that since there was, although there was a planned agenda item, which the department withdrew today, this testimony that we heard should have happened at the front of the meeting, not at the back. Would have been much more helpful to us. Usually we would hear material on the subject, which always is about solitary, about restrictive housing and young adults today. But if there are not going to be any agenda item which involves a vote by the board, then we should have the public comments before the board meeting. I must say that at the very least, what I've listened to for the past period has been at least or more informative than what I heard from during the meeting itself today. Thank you.
Bobby. Good point. So first of all, I want to acknowledge the death of Mr. Cruz and how wholeheartedly myself and many of the members, all the members of the board feel about it, and we plan to do due diligence on that case. I want to inform everyone that our next public meeting is scheduled for November 11 at 9 p.m. The meeting will be also held through WebEx. Details will be available in the website. And you can send an email if you're interested in testifying. And again, particularly now, I want to remind. Sorry, go ahead.
Yeah, could I just say one last thing? It's James Marino. I agree with Bobby. I'm sorry I jumped in late, but I agree with Bobby. We should have done this in the beginning. That was very powerful testimony from a lot of people. And yeah, I agree with you, Bobby. Thank you. Thank you, Franco.
Thank you, everyone. And again, an important note, make sure that you and your loved ones vote. Thank you, everyone, for your time and knowledge.
Thank you.